Finding the meeting.
Okay.
Just put a link to the YouTube page on the Facebook.
Give them the link you have, that'll make them pay.
Sure.
No, not Zoom, YouTube, the YouTube, right? Isn't that where we're streaming to?
Not yet.
Why am I so loud?
Turned it on.
We're not there yet.
We're not there yet?
It's not there yet. Well, I just clicked it.
I've never been there yet.
We're not there yet.
Okay.
Broadcasting on YouTube. And is everybody into board docs?
Mhm.
Yes.
Only a 7-minute delay. Okay.
Okay.
Not bad.
I think we're ready. Brian, are we ready? Ryan, we ready?
As far as I'm concerned.
Okay. It is 5:07 now. This is a regular Board of Education meeting. Can you call the roll, please?
Mrs. Niekamp,
Here.
Mr. Kristoff,
Here.
Mrs. Sanders,
Here.
Mr. Lopez,
Here.
Mrs. Olszewski.
Here.
Could you please stand and join us in the Pledge of Allegiance, followed by a moment of silence?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you all for joining us. We joined a few minutes late because despite how many times we practice, it's still not that simple to get us all here and to you on the media. So is there a motion to approve the agenda this evening? So moved.
Second.
Discussion? Call the roll, please.
Mr. Kristoff,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez,
Yes.
Mrs. Olszewski,
Yes.
Mrs. Niekamp.
Yes. Next, we have public participation. We have one speaker this evening, Heather Tinsley, who represents Pickerington Education Association. Heather?
Good evening. Teachers want nothing more than to have all of our students back in the classroom on a regular schedule, but teacher and student safety must be the top priority. Currently, there are more questions than answers when addressing COVID-19 protocols. There's no existing policy or precedent to follow. That is why seeking input from teachers, parents, and medical professionals is more important now than ever before. I will outline our questions and concerns regarding the recommendation to move to status level green on the Flexible Learning 2.0 district plan. Number one, what data is being considered and where is the guidance coming from to indicate that PLSD is in a position to reopen our schools 5 days per week? Number two, the district has shared that they will now be providing medical grade masks to classroom teachers with the expectation that the use of these masks will eliminate the requirement for contact tracing with teachers. According to the CDC interim guidance for case investigation and contact tracing in K-12 schools, updated September 24th, 2020, case investigation and contact tracing are essential interventions in a successful response to COVID-19 in K-12 schools. As schools resume in-person learning, it should be considered a crucial strategy to reduce further transmission once a case is identified. Therefore, we ask where the district's recommended protocols coming from and what evidence is being used to make a decision that ignores CDC recommended protocols. Number 3, the district's original COVID-19 plan included a required provision that buildings would receive a deep cleaning on Wednesdays when there are no students in the buildings. With all students back under the proposed return plan, how will deep cleaning happen when that commitment is not being met now? When PEA asked the district custodial staff about what deep cleaning entailed, we were told, the buildings are cleaned the same way, except there's more time to get all the spaces, even the ones not being used, and a thorough cleaning of the high traffic areas. Our custodial staff is amazing and doing what they can to fulfill the district's commitment, but they need more help. Is there a plan to hire additional custodians to ensure the necessary levels of cleaning and sanitizing? Number 4, we are concerned about the substantial risk of exposure for students, families, teachers, staff, and the impact on the community. Since we won't be able to maintain any of the 3 to 6 foot social distancing, the risk of exposure is much higher in all of our schools. Number 5, teachers and parents are frustrated by the district's lack of communication. Teachers and building administrators had no say in the recommendation that is being brought forward tonight. To be clear, there is a district COVID-19 task force committee. That committee does include representation of teachers, support staff, administrators, and Board of Education members. The stated purpose of this committee was to gather input from those most directly impacted by the changes to school protocols. The community at large trusts that recommendations are coming from the committee. However, we know that is not the case. The directive to reopen for all in-person instruction was developed without the input of this committee. The committee was then charged with developing an implementation strategy for the plan, rather than working together to ensure the recommendation reflects the will and readiness of the community, teachers, and staff. The Pickerington Education Association want a safe return for our students, teachers, and families. We insist on transparency and prompt communication from the board. Thank you.
You got a pen club.
Treasurer's report, Ryan, thank you.
Thank you, Heather.
Thanks, Heather.
Let me finish here.
And since we haven't had a presentation, obviously we can't personally answer the specifics of those kind of questions. We're going to assume that some of those will be addressed when you make the presentation.
That is correct.
Thank you.
All right, I tried to capture that as best I could. Okay, so you have the minutes from September 21, September 28, and October 5. If there are any questions, otherwise they're there for your
Is there a
approval.
motion? So moved.
Second.
Discussion? Sorry if you weren't done saying that. I thought you were.
I'm good.
Call the roll, please.
Mrs. Sanders,
Yes.
Mr. Lopez,
Yes.
Mrs. Olszewski,
Yes.
Mrs. Niekamp,
Yes.
Mr. Christoph.
Yes.
Next are budget and purpose statements. At this point in time, you should only see moving forward funds 200. None of your 018s or 007s for the buildings. The expiration date is come and gone.
Motion to approve.
Second.
Discussion? Call the roll, please.
Mr. Lopez,
Yes.
Mrs. Olszewski,
Yes.
Mrs. Niekamp,
Yes.
Mr. Christoph,
Yes.
Mrs. Sanders.
Yes.
Little switch up here. The donations are next. You can see that those have been brought up to speed. We would have gotten for district use, a Manfrotto switch arm wheelchair, and 2 AbleNet Jelly Bean twist switches. And I do not know what those are.
They're special education assistive technology devices.
And then also in September, the Panther Booster Club gave their annual donation to the North Athletics of $30,000. The final item are 2 settlement agreements to settle BOR and/or BTA cases with Realty Income Properties 9 and Stone Creek Acquisition.
Is there a motion?
So moved.
Second.
Any comment? You need to comment at all,
Discuss, do you need anything?
a resolution as far as what that is? I mean, you just want to
Oh,
talk
so
about what it
the-
is real quick?
Yeah, the Realty Income Properties 9 would be the owner, the real estate owner of the Tractor Supply Company. And Stone Creek Acquisition would be the strip mall that is Lifetime Fitness, Roosters, and whatever else is in that strip. Ultimately, what has happened is there was, through the process of Board of Revisions, there would have been tax complaints either filed or counterfiled. And to settle those complaints, we've reached direct payment agreements with these 2 entities. The BORs will drop. I believe in the Realty Income Properties case, the direct payment is that we have 2 of them. We started with one about $11,300. We'll get one reasonably close to that, another one in February. The Stone Creek direct payment was more along the lines of, I want to say $38,000 or $39,000. And we'll get a second payment off of that one as well in February.
What's the difference between BOR and BTA?
Board of Revision
Yeah.
versus Board of Tax Appeals.
Oh.
So the first level is at the county level. That's the Board of Revisions.
Right.
And it's normally the auditor,
Right,
the county prosecutor,
right.
and the county treasurer. Whatever case happens, or whatever happens there, if it gets appealed to a 3-member panel that handles tax complaints across the entire state.
So that's the BTA.
That's correct.
That's the state level.
That's correct.
So in other words, Realty Income Properties appealed the BOR's ruling. Stone Creek Acquisition did not.
Correct.
Okay, gotcha.
It never got to BTA. Yeah, if you see BTA, it got to the state level. There's a few more that will be going to state level that probably within the next 2 to 3 months, you guys will see those as well.
Right. There's a motion and a second. Any further discussion? Call the roll, please.
Mrs. Olszewski,
Yes,
Mrs. Niekamp,
Yes.
Mr. Kristoff,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez.
Yes.
We now have the consent agenda. Chris?
Yes, board members, this evening under consent agenda items, we are asking the board to approve the unpaid leave of absence for the STR disability as listed. Excuse me there. We also have an unpaid leave of absence, accept the request unpaid leave of absence for the following employees for the 3 that are listed in their positions and their date of return. And the Certificated Pride of Pickerington POPs 2019 and 20 district-wide award to approve a $500 stipend for Shauna Holt for the district-wide certificate POPs award winner. And then we're asking the board to approve this evening substitute teachers as listed for this school year. That is number 1 under certificated items. Is there any questions from board members?
yeah, either for you or
Yes,
Heather. I'm assuming that, well, let me not assume. Is our sub list down this year, or are we seeing any noticeable change from, say, last year at this time in general?
That would probably be a Heather
Is
question.
that a Heather question?
Yeah, I'm not sure what our numbers are. Or Zach.
She's leaning forward to unmute. She's looking for her button and go.
I'm here. We looked at the numbers from last year for September and October compared to this past September and the last 4 or 5 days and work days in October. And last year, the unfilled absences were higher than they are at this point in this school year.
Which is a positive.
Yes.
Unfilled absences, meaning,
We could.
We did not have subs to fill certificated vacancies.
gotcha.
But as compared to last year, this year is much lower than it is this past year. This year's lower than last year.
Yes. And we anticipate this to continue to be a problem throughout the school year because it is before COVID-19, we had sub issues. So if we continue to keep doing what we're doing, it's pretty good. But I know approving the subs on the agenda tonight gives us additional pool of candidates to look at.
Right. Thank you.
Any other questions on certificated licensed personnel? Hearing none, support personnel. We are asking the board this evening to approve the resignations / retirements of the following individuals as listed. We do have an unpaid leave of absence for the two people as listed in their positions. Unpaid leave of absence for SERS disability for the person as listed. And we have a contract adjustment for two individuals, and we have their adjustments listed. And then contract and salary adjustment from a duty aide to another duty aide position. Classified recall from reduction of force. We're bringing this person back as a cook cashier at Pickerington High School Central. And then substitute support service recommendations. These are normal with the duty aide hour, kindergarten aides, library aides, and paraprofessionals for the individuals as listed in the hourly rate. And then classified pride of Pickerington District Award, $500 stipend for Carrie for this school year. Congratulations to her. And that is the support personnel section of the agenda. Is there any questions from board members? Hearing none. Number 3 is personnel supplemental contracts and stipends. We have a supplemental contract rescission. I can never say this rescission. Thank you. A supplemental contract resignation as listed. And then we have supplemental contract and stipend recommendations as listed for the schools, both high schools, Ridgeview STEM Junior High and Lakeview Junior High. And then also on the agenda this evening, we have 2021 stipends for the people as listed in their buildings. We have game workers. We're asking the board to approve this evening one. And then we have a ticket seller and tournament worker, which is normal that we ask for board approval this evening as well. And that is the personnel supplemental contracts and stipends section. Is there any questions from board members? Hearing none, going to consent other. We are asking the board to approve this evening early graduation request from the individuals as listed, one from North and then the rest are from the alternative high school. And then under executive, that just tells you during their senior year what their accomplishments were. And that is the consent agenda items as listed. Is there any questions from board members?
Nope, motion to approve. Oh, I thought we were there.
We are,
That is
We are.
approval of consent agenda items.
because number 6 is going to be separate.
Yep.
Is there a motion from Vanessa? Is there a second?
Second.
Discussion? Thank you, Chris. Anyways, call the roll, please.
Mrs. Olszewski,
Yes.
Mrs. Niekamp,
Yes.
Mr. Christoph,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez.
Yes.
The last thing that we have is a certificate of resignation, which is a separate item to accept the letter of resignation from Craig Huffman from Pickerington High School Central Visual Arts Center arts teacher, effective October 12th, 2020.
So moved. Second.
Discussion?
I would just say that although I'm in favor of Mr. Huffman not being a part of our staff, I have to vote my conscience on this, and I would prefer he be removed. So I'll be voting no on the motion to accept his resignation.
A motion and a
Any other
second. Any
questions?
further discussion? Call the roll, please.
Mrs. Niekamp,
No.
Mr. Christoph,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez,
Yes.
Mrs. Olszewski.
Yes.
Thank you, board. You would like for me to go ahead, Lori, to
Yes,
continue?
please.
Discussion action items for this evening. Board, we have administrator unpaid leave of absence. We're asking the board to accept the request of the unpaid leave of absence for Dr. Raquel Major Holland from Sycamore Creek. Also under discussion, is there any discussion item? Sorry, I didn't mean to jump ahead. Is there any discussion from board members on that request?
Can we have a motion?
Thank you.
It's okay. We'll keep it
So
going.
moved.
Is there a motion, please?
So moved.
Second.
Any further discussion? Call the roll, please.
Mr. Christoph,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez,
Yes.
Mrs. Olszewski,
Yes.
Mrs. Niekamp.
Yes.
Board members, the second thing under discussion action, we do have policy changes for the two policies as listed. We're asking the board to approve that this evening.
I know you all just saw investments like a board meeting ago. Neola sent out a oops, our bad. They left one line out.
Kind of
Literally,
important.
literally what it says is that for the debt of other municipalities, which we are actually able to invest in, that is the one exception to where we can go out to 10 years. So even though in one place it talked about the debt instruments of other municipalities up to 10 years, it then later in the document said the maximum I could go was 5 years. So they threw in the wonderful word notwithstanding now to allow us to anything other than the municipality debt is still 5 years. So with that being said, I'm asking if it's okay for us to just simply approve that.
Motion to approve?
Second.
Discussion.
Yes, I would like to have Bob explain the rationale behind the changes to the eligibility of residency policy. I guess candidly, this it wasn't on my focus time ago when it was on for first read. So I don't think I'm supportive of this, but if you could explain to the team, Bob, why this is being changes are made.
The 5111 policy addresses our residency issues, covers multiple areas. One of the areas that we're requesting changes we made to is our what we used to call our friends and family program. We would like to call that shared residency as one of the changes. But after meeting with our legal counsel in regards to some of the legal requirements that we were asking families to provide for proof of residency, we were told we really could not do that. One of the things that we were requesting is that that the individuals provide us with a lease or mortgage statement or a deed showing that they are either renting or purchasing or have purchased property in Pickerington. The law only requires them to provide proof of residency, and there's multiple ways to provide those proof of residency besides renting or owning property. So after meeting with our legal counsel, those documents, but that can't be the only documents that we use to prove residency. So we're asking that those adjustments be made to our current procedures, and that we're not requiring that to be done every year. That once a family has proven residency in the district, that they would continue to be considered residents of the district unless there is a change of address, and at that point they would have to go over the whole process again and prove residency again.
But Bob, didn't we just add the piece several years ago where they had to provide it every year? And didn't we also find that there's a lot of people that probably couldn't produce that?
That's what's happening right now, Mrs. Sanders, is that we have a hold list every year since we're requiring these families to go back and produce these documents again. So we typically have anywhere from 40 to 60 students that are being held out to prove residency each and every year under this particular program.
But don't we want them to prove that they live here?
Well, if they provide the necessary documents the first time, they've proven that they live here. So the question is, do we want to continue to make them go back every year and prove residency if they've already proven that with the initial documents that they provide us in order to enroll in our school district?
Well, I mean, I can understand, sorry, and I'll let you go. I just have one.
Sorry.
I can understand where there was a concern about what we were asking for. I get that from legal counsel, but what I don't understand is why we would want to go back to not checking those every year. That's my only hang up. If there's things we shouldn't be asking for, then by all means, we should change that list. But I still think that people should be required to produce yearly that they live there. It's not like we're building a house, moving into the neighborhood, or we've moved into an apartment or condo. This is, I'm staying with my friends or family for now. And
But keep
I
in
still
mind, the
feel like
majority-
we should be asking for that every year.
Yeah, the majority of these people don't change their addresses. They're still living with their, their significant other or their family, and have proven residency. So, the question is, do we want to continue to force them every year to go back and do this? Which in many cases it ends up the kids are held out of school until the necessary documents are provided once again, and they haven't changed residency. They're still living in the same place.
We don't ask for that in the summer. I mean, why would they be held out of school?
Well, we do. We have been telling them that they have to produce this every year. They have to complete a friends and family affidavit every year and provide the necessary documents. But again, that's one of those cases where every year we have a list of about 40 to 60 families or students who are held out of school until those documents are provided.
Would you say that of those 40 to 60 kids that are held out because they didn't send their documents, would you say the majority of those kids finally do end up staying with their documents, or do they end up just not showing up?
Yeah, the majority of these families they're still in the same location. They haven't moved from the current location. They're still staying with either their grandparents, or a significant other, a friend. The majority of them are still in the same location, but we're still requiring them to go back every year and provide the same documents, which we don't do that with other students who enroll, either through renting an apartment or purchasing a house.
Right.
But Bob, don't we start sending out reminders even before the school year ends to say, hey, make sure for next year that those documents are in line for enrollment for the fall purposes?
Yeah, the Welcome Center does notify the families who we have on Friends and Family, that we do send out like a general email to all those families telling them that they have to complete a Friends and Family affidavit again. Yes.
And then, the other thing too, I know that I mean, our policy does say that this is for an emergency situation. So to me, if we're not making, we're not going to be following our own policy if we're going to say that someone can verify an address for one time and then stay in the district 5, 6, 7, 8 years. I mean, the word emergency to me does not mean an overly
Indefinitely.
extended period of
Well,
time.
keep in mind, the word emergency does not exist in legislation either. We put that in there. So really the circumstances with most of these families is not an emergency situation. They've made the decision to move in with, with their parents or a significant other. And it's not an emergency situation. It's just something that they've decided they're going to do, and and typically year after year, they're in that same situation. And that's not to say every situation that we're dealing with is that case. So if we suspect that somebody is not living where they said they were living, then we would obviously follow up on that and investigate and require those families then to produce the necessary documents.
I just think it's very difficult over the years that we get told a lot. There's a lot of people that really don't live here that have used this particular policy to be able to say, I'm staying with so-and-so, and then within X period of time, I'm back at my house across town and mom's just driving me into Pickerington every day to go to school. Now, I know no matter what we do, we would have to evaluate that on a case-by-case basis. But for me, if there's one more layer of giving us something once a year that shows you actually have your name hooked to that address, I don't see the drawback of still doing it once a year. I mean, I know that's been some of the discussion that I've talked to about, with our policy people and board members is there really isn't a downside if we give people enough notice, which we're doing, to say you've got to do this before your child can start school. I think that's all we can do.
So just to clarify, the policy does not state that we require families to prove every year, or it does and we're ignoring it, or what?
No,
what
and
comes out?
the current policy does state that they have to repeat this process every year. They have to complete a friends and family affidavit every year. What we're recommending is that if they've proven residency already through the necessary documents that the state requires, that we would not require them to come back every year and have to prove that, and unless they actually move to another residency, then they have to do it all over again. That's what we're recommending, but it doesn't sound like we want to change the policy.
I mean, I can understand that you do change what they need to produce. If we were asking for things that are maybe not legally or they're too strict, then that change, I think, makes total sense. If what we're asking, it was not within what we, could have been asking for proof, but how often we ask for it, I think, is the question. Am I the only one? I know
I
you
agree.
have the same
No,
question.
I agree.
I guess I'll go to something Lori said. And look, we received some emails as school began about the cumbersome nature of this process. So
Sure.
maybe we can talk about that. Is there a wiggle room somewhere, somehow? But I will also agree that this friends and family policy should be of a short-term nature, not an all-in, you're here here forever. I don't know where the happy medium is. I mean, we do have angry parents. We've received a number of emails over the summer. And we have some situations where they were waiting on, documents, and COVID shut down such and such an office and they didn't have access to a fax, blah, 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 blah. But we also have to balance that with getting kids in school. I mean, keeping a child out of school for 6 weeks is just out. I mean, that's not why we're
Who
here.
said 6 weeks?
That's what Bob said, right? Aren't you are you?
Yes, we still have 28 students who are out of school because they haven't proven residency.
And when did the
I think
parents,
that got narrowed down to 25. Is that correct, Ron?
and when were the parents notified that they needed to do that? Last spring?
Yeah, they were notified, yes, that they needed to provide the documents back in the spring.
Okay, so at that point, whose responsibility is it at that point?
Well, and this, I mean, so do we table this for another meeting so we can have sort of these conversations? I mean, is there an urgency right now in the middle of October? I don't mean to dismiss the ask, but there seems to be.
We're still following the same procedures for this year. We're still trying to get the documents from those families. We're still requiring them to provide the documents. We have tried to follow up with the buildings, with the Welcome Center, with many of these families. Some of them are leaving the district. They're going to online schools or somewhere else because of the process. So,
Well, which potentially means they may have not really been living here anyways anymore.
it could have, yeah.
That's the reality.
Yeah. So,
I mean, it just hurts my heart that we've got kids not enrolled.
Absolutely.
I mean, this is not. We're here to educate kids, not shove.
and
we've
we've used our legal authorities. We've contacted CPS. We've contacted our police officers our SROs to help us with the process. So we are notifying the families that they need to get their kids in schools.
I think the one thing, and Kathy knows which one we got. It wasn't the fact that there was a problem. There wasn't the timing of it. It was what we were asking. That was a classic example of what we were asking was following a bouncing tennis ball. And it was so, I mean, I know it was resolved, but that was a highlighted situation where makes total sense that this policy would be altered, that what we were asking might have been excessive or, but I just, from my perspective, I mean, to ask somebody to do that every year, I mean, if you aren't renting an apartment or you aren't living in a home or something, is it unrealistic to ask people to verify that you'd live here? I mean, this isn't a lot of people. but I don't know.
How many people is it, Bob? Or families, do you know roughly?
Well, typically, we have about 600 families that use this shared residency program that are not actually renting themselves, where they're on a lease or purchase property here. So you're looking at about 600 families who do that, or 600 students, I should say.
So out of the 600 currently, Bob, then we have 25 that still aren't in compliance, but we've at least attempted to reach out to them through CPS, through police, through building administrators to find out what's going on.
That's correct. Yeah.
So we don't really know that they're even still here.
At this point, well, some of those we do know are here, and we're going to. Some of them were, a couple of them were VLA students, so we're going to eliminate their access, which they shouldn't have been given access to begin with. But I think in some cases they were, in order for them to provide the necessary documents. But some of them we do know have started the enrollment process either in a charter school or somewhere else, but haven't followed through on that. So we just need to follow up with those families and make sure that they get the process done, so we can completely remove them from our books.
And no one's taken off of our books, right, Bob, until we get confirmation from another district or another program requesting their records?
That's typically the way it has worked. I have had some discussions with Ron and with Mrs. Lopez at the Welcome Center, if we can verify that they are living in another district, and we provided that district with the necessary information, address, and so forth, we're going to go ahead and remove them from our books at that point.
And I am in no way trying to be punitive. We all want the kids to actually be in school if they live here. So
Correct.
I just,
Bob, can I ask you a quick question? Do you think that since if I understand correctly, they could still provide the same documents as before, it's just now there's more options? They can provide, other documents instead of just the narrow list that we had, if I'm understanding you correctly. Do we think that any of these 20 or 25 that are still left with the relaxed rules or the expanded options, if you will, that will help those 20 or 25? Do we have any knowledge of that?
Yeah, we hope so, Mr. Kristoff. We're not hearing back from many of these families, even though we've reached out to them. So, we hope we can work with them and allow them to be a little more flexible with the documents that we are requiring at the state, a list of the things that the state does require for us to provide. In the past, we have requested that they get on a lease with whomever they're staying with. But obviously that's not one of the things that we can actually require them to do, but we'll continue to ask for that. We still think it's important that be the mortgage or the rental lease is the most important document that proves residency in our district. So we'll continue to ask for that. But obviously if they're unable to produce that, then we do have a list of other documents we can go to.
Yeah, if they're living with grandma, they're not going to be able to produce a lease.
right.
And
but
I
they
can see
probably
where there's
could produce-
legitimate reasons where they'd be living with grandma and they'd be living with grandma for 6 years.
Well,
Yeah.
that's what we're seeing with many of our families, that they've chosen
could
this
have
as
bank
an
statements.
avenue. Yeah.
Yeah, I don't know what the other
All
things
those
is.
other
I believe I agree with you that if there's a way that we can do this to go ahead and still be able to accept that, the expanded list, if you will, but accept that on a yearly basis, I think that.
Well, we have our new practices ready to go for next school year. Actually, we have them in place this year, but we're still asking families to contact the Welcome Center, and that those options would be discussed with them. So what I would recommend then, is everyone okay with changing the title to shared residency, which kind of makes more sense than friends and family? But we leave the other information in there about the yearly or the annual renewal of that shared residency.
I think that's,
Say that again, Bob, for
So
the
we-
flow of listening.
So we just changed the name of the program. Instead of friends and family, we changed it to shared residency, which we saw a lot of districts call it that. because that's what they're doing. They're sharing residency with somebody living in our district, and leave the other information in there that they still have to renew every year with the Welcome Center.
Yeah, I guess too, before next year, because we don't have anything else to do this year in anticipation of next year. I mean, maybe you and Ron and Mrs. Lopez, the Welcome Center, I just had to say that. Are we really asking for the right paperwork?
Yes.
Oh, okay, all right. I look forward to new emails next year.
So there was a motion and a second for the way that this was written. Does the motion and the second want to amend to just changing the title and leaving to where it's checked on an annual basis?
Yes.
I don't know which one it was.
I thought I was-
I don't know. I don't remember who was what now.
Hold on.
Because it was
I don't
like
either.
yesterday.
Hold on just a second.
I think Vanessa was one.
So would Mrs. Niekamp be willing to change her motion and Mr. Christoph be willing to accept as a second a motion to approve policy 6144 in its entirety and to accept only the following changes from policy 5111, change friends and family to shared residency affidavit?
Yes.
Yes.
Then we're covered.
Okay. There's a motion and a second. Is there further discussion? Call the roll, please.
Mrs. Niekamp,
Yes.
Mr. Christoph,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez? Yes. Mrs. Olszewski?
Yes.
Ready?
Yes.
Board members, this evening, obviously, we have very passionate teachers, and this is a very direct plan that we're presenting tonight. And first of all, I just want to kick this off by thanking our teachers and our support staff, our custodial staff, our administrators, our district office staff. All of them have made the best of a very difficult situation, and they made the hybrid model work, and kudos to them. The hybrid model and the virtual learning academy, the amount of hours we put in, I know as a district office staff with teachers and input to implement successfully took a lot of people to be dedicated to our students. So thank you. The return to school, one of the things we know that no one plan is going to make everyone happy. Obviously, it's a challenge. The discussion to return to school is not taken lightly or without consideration of the health and safety of our students and staff. Obviously, that's our number one priority. The Flexible Learning Plan 2.0, our ultimate goal from the very beginning was to transition students back to the green model. And all of us want our students back in our school building. We heard that from our teaching staff outside today. And we all want the same thing. It's just we have to figure out how to get there. The green model is the in-person instruction. My biggest concern, as I shared with our teachers outside, is students and families' mental health and physical well-being is a consideration in this decision, as well as the equity and access of resources. We do have families who do, even though we're providing one-to-one initiative, are struggling, whether it's virtual learning academy or whether it's hybrid model. It is a challenge for some of those families. So that is a consideration. The plan itself, we are recommending to the board, at least for discussion and if you prefer action tonight, but the students will return to in-person instruction, which is our green model, starting on Monday, November 16th. We considered the 16th, we considered a couple of days earlier. The 16th is the end of a trimester, but it's also a Monday. What we are doing is students will attend in-person classes Monday and Tuesday, Thursday and Friday. We will keep Wednesday as a virtual day. You heard that one of the concerns from the teachers is that deep cleaning day, a chance for people to get access to the building without kids in it. That maintains our Wednesday schedule. Wednesdays also allows us to have our virtual learning academy teachers touch base with their students because they currently won't have that opportunity if we're all in 5 days a week. So we are recommending keeping that Wednesday until the end of the first semester. That's 3 Wednesdays from November 16th on. And it allows us to kind of give us a gauge of where we're at as far as the actual cases go. And the other reason we chose November 16th is, and this is what I tried to share, is some people are saying, why would you start before Thanksgiving and winter break? Well, the reason being is regardless, we have to rely on our families to follow protocol. And we are relying on our families and our students to do the right thing. And whether they start school on the 16th or come back in January under this plan, if they don't follow protocol during the winter break or Thanksgiving break, we're going to have cases. And so we are asking our families to work with us to, maintain the current status of what they're doing and the protocols that are put in place to keep our kids safe. So we are asking them to do something during Thanksgiving and winter break, and hopefully they will do their part to keep this and make this plan happen. The November 16th start day is also allows us for 7 days before Thanksgiving break. Those 7 days all in, those 4 days a week, I think will tell us a lot. And I hate to say we have 2 breaks, but we do. Those 7 days that are in, we get a feel of how things are working. We get a chance to take a gauge on the cases, or if there are any cases or not. We'll have some of that information as well. After the break, obviously 3 weeks of classes before winter break, we understand that families are going to travel. We understand that families are going to spend time together. We asked, again, as I said before, to please practice appropriate protocols and make this transition successful, because it is going to rely on more than just school personnel. And we are concerned about, obviously, kids gathering outside of school or in large groups. And we want to continue to stress that that protocol should not be followed. The other things too is we have 4 weeks from now, if we use the November 16th date as kind of our gauge and monitoring our current COVID-19 data before the return of school plan is implemented. So as I mentioned outside, if things go sideways in a hurry, we still have our hybrid plan in place. We've done virtual learning before. So those don't change. And the next 3 weeks could tell us a lot. We're going to continue to monitor the cases locally. I think it's the important piece that we talk about here. There is a spike in cases in the state of Ohio. We know that, but we're looking at local data. We're looking at community data and what that looks like. And that's what we'll monitor for the next 3-4 weeks before we implement this plan. I did have a conversation with Joe Mazzola, the Franklin County Health Commissioner. We are under the jurisdiction of Franklin County Health. He did confirm that. They do work with our city of Pickerington. I also had a chance to talk with Alex Jones, who is a contagious disease specialist who works with Joe. And we had a good conversation, and I shared our plan with him and Alex. Obviously, their biggest concern is the social distancing piece when we return kids to school. And that will be our biggest challenge. We won't be able to accommodate the 6 feet, but that doesn't mean that we can't do our best at looking at our classrooms and how we can social distance kids and keep them safe. We still expect students and staff to wear masks. One of the things that we are doing is we are providing our staff with medically approved masks. Now, the question came up is, N95s, they don't have to be N95s to be medically approved. We are using, obviously, I think the CDC approach when it comes to how they identify these safe masks, and we're going to provide our staff those. What that means, and what Heather was speaking about, is that does eliminate our teachers from contact tracing. So if there's a case in the room and the teacher's wearing a medically fragile mask or medically accepted mask, they are excluded from the contact tracing. So it's been proven to be safe. And a lot of questions came up about our students. What I would say is if I had students and I do this with my own daughter who's in school, I would buy medically approved masks for safety. And I think they're accessible to our families.
I am Dr. Briggs.
Yes, sir.
Just because we've had questions about that. I am sharing the public record, an email from Alex Jones herself, noting medical surgical grade masks may be used by staff who have frequent unavoidable close contact with students. So in other words, these medical grade masks go above and beyond what she ultimately says, and I'll get to the bottom of it here in just a second. If a child they've been in close contact with for less than 6 feet for 15 minutes or more later tests positive, the staff member would not have to quarantine. If the child is wearing a cloth facial covering and the school staff is wearing a medical surgical grade mask, if the child is not wearing a cloth facial covering, which is in a lot of cases are special ed settings, then if that staff member had a medical grade mask and a face shield and goggles, we have provided all of that PPE to our teachers. They all will have medical grade masks. They've all been provided two durable, reusable face shields. In fact, the reason I brought up what I did, she kind of went on to say, but we're really not recommending that you have to go that far. So when I stated earlier, as Dr. Briggs and I were outside, that we are adequately meeting our staff safety, adequate was just a choice of words that in no way means that we're just barely getting there. We are meeting our PPE needs for our staff and ultimately doing so in such a way that even Alex is saying, hey, normal cloth facial coverings are more than sufficient for the majority of staff members. But in order for our staff to feel even more confident about their safety and security, these medical grade masks ultimately will allow our staff to, even if we get into a scenario where a child is identified as being infected, as long as they have those medical grade masks on, when the contact tracing gets to the teacher or the staff member, and we're not talking just teachers, we're talking all of our building staff that want those masks, then that contact tracing actually would end right there, and it's a cold trail, and that individual does not have to quarantine. And this is an email directly from Alex.
So if I could stay on this topic, because he's got it on the screen. Sorry to interrupt your
okay.
flow there. According to what Alex, is a she,
Yes.
Correct.
has in this email, it's a medical grade surgical mask. So my assumption is it's worn in surgical suites. Chris, you mentioned that Alex is an infectious disease.
That's my understanding. She
Yeah, no,
deals with
at her, if you could scroll down.
she's been handling, I know, a lot of the school issues.
She
that we've dealt
is,
with.
she's got her degrees in public health.
Yeah.
She's a nurse with a degree with an emphasis in public health. So while all of our public health folks around the country are focused on this virus, I don't think it's really fair to call Alex an infectious disease
Well,
expert.
that is what she deals with the Department of Health. And she's also dealt with our football teams, any kind of cases we've had. Mark has dealt with her directly. Very knowledgeable lady, and she does deal with infectious diseases. I mean, that's her role with the Department of Health.
We feel confident in having taken the guidance from the Franklin County Department of Health and having talked to their commissioner and having talked to Alex, who's really been on board with the district from day one. I feel pretty confident that if she says this, that's how the Franklin County Department of Health views it. I'm sure you could go find, if you look hard enough, somebody out there who says it's not good enough, but who we've been reporting to and who we've been talking with all along. I hope everyone agrees in this room has been the Franklin County Department of Health. Is that everybody's recollection?
Yes, and I could probably go. I've been told also that the Ohio State Medical Center, including the cancer medical centers, use the exact same thing. If they have a medical grade mask on, that's where the contact tracing stops. So it isn't being eliminated. I think being eliminated from contact tracing is not the same as the contact tracing stops there. That's
Correct.
There's
Correct.
two different.
Correct.
Sorry, I didn't choose my words well. Once it gets to
And neither
you,
did Heather.
Yes.
correct.
Neither did Heather.
You would not be told
Right.
you have to
You have to
quarantine.
quarantine.
Correct.
Right.
Yeah, sorry
So,
about that.
yes. So, yeah, there's a big distinction. They're immune from
Yes.
contract. If they're
Correct.
worried, then that's where the contract tracing stops. There's no
Absolutely.
more phone calls need to be made.
That's correct.
It's not that they're, so I
At
think
least with
that's a
that
big-
link of the chain.
That
picture would be
one
stopped.
link of the chain.
Yes, you then have to check with the other kids.
Exactly.
Correct.
But I think that's a important clarification.
And also the clarification on the health departments, because we get these questions a lot. Well, we're in Fairfield County.
Correct.
Well, we're actually in Fairfield County and a little bit in Franklin County, but it's other services. It's not like the health department just popped up to us when
Correct.
COVID came. It's other health services that we have always gotten from
Correct.
the health departments. And Fairfield County may not have the same services as Franklin
is
because,
correct.
let's face it, it's a little larger.
Absolutely.
It's just like COVID testing right now. You can't go to the Fairfield County Health Department to get a COVID test, but you can through Franklin County.
Yeah. And Joe was very clear in our conversation, the two health departments and health departments throughout the state do have different protocols, and they may not be the same. I think they all have the same goal in mind, but they may not always be the same protocols for districts and for schools especially. The other thing I wanted to say too, one of the recommendations is we know we're going to have some challenges with lunches and large groups. And I do take a little bit of offense that the principals weren't involved in the discussion because they were. And principals are going to be vital and critical. Our building principals will be critical in implementing this plan because we're asking them to develop a plan to look at trying to keep kids from large groups. I'll just use an example that, my daughter's at New Albany. They are all in. She's assigned to a specific lunch table every day with the same group of kids. And that's just the way it is. And that's what we may have to do. And we have to spread kids out. And she also, they've done the same thing we have. I know they think that's a small high school, but it's about 1,200 students. So they're making it work. Also, I want to just point out too, the data does support 45% of the schools in the state of Ohio are 5 days instruction right now, 45%. I know that's not popular around the 270 outer belt, but the one thing that Joe said to me that really struck home was he's having these conversations with every district in Central Ohio. So it's not like they're just implementing the hybrid model and then saying we're going to stay in it for forever. He's having conversations about trying to get students back in the buildings with every school district. So that's the positive part. And the bonus that we had is that we were able to implement the hybrid model right at the beginning of the school year. So we've had time to see it in action where other school districts are just now starting to transition to it. So I think that's a big bonus for us as we look at this 4-day schedule. The other thing I would say too is, I have to say kudos to our staff and coaches and teachers for being able to have an opportunity for our kids to participate in what they've been able to participate in. You look at football, you look at bands, you look at all those things that are concerning to us with large groups, and they've made it work. They really followed protocol. We've had some situations, and I don't want anybody to think that we're sitting here naive enough to know that we're not going to have cases in our buildings. We are having cases now in the hybrid approach. So we'll have cases when we go 4 days, but I think that's going to happen regardless. And the other thing that I just wanted to say is, and I kind of wrote this down, this is a very difficult decision for the board, for myself, making a recommendation, and it's going to be unpopular with, a large portion of our community. It's going to be popular with a lot of them. A lot of them want their kids back in school. And the other thing I want to say is that, we've begun discussing how to get our students back in school. And please, I just ask for everybody to please be patient and show some grace. We're making the decisions the best way that we possibly can. This is not an easy task. And we're going to do the best we possibly can to try to get our kids back in school. And so this is a step forward. Is it a perfect plan? I don't know. But I do know that our community deserves to have a plan and at least know that we're working to get their kids back in the building. And I am totally, my biggest fear is the mental health of our students. We heard it from our teachers outside. There are students who are struggling. There are families who are struggling. And I don't dismiss that. And I think when you have conversations with the community, you're probably hearing the same thing I'm hearing from my neighbors and from people. Some of them want their kids back in school tomorrow. Some of them are nervous about putting their kids back in school. We've got to discuss all those options between now and November 16th. And that's my plan. We're working as a leadership team to put some things in place. Staffing is always going to be an issue when you're looking at virtual learning academy and a hybrid model and transitioning to 4 days. We do think the Wednesday does give our staff a chance to catch their breath and also do, the virtual learning teachers to check in with them, like we said, but it also, I think Dr. Woodruff would tell you, they feel that that's a critical time if we can keep that at least until the end of the semester to allow them to continue the work they're doing. and then we can reevaluate at the end of the semester. And I think that's a good time. Again, the 16th we did look at a couple days early. The 16th isn't the end of a trimester. So it's a fresh start on a Monday. And it would be all
But for
kids.
just the junior high students, right?
No.
We don't have trimesters except.
Well,
for the
I'm
junior-
sorry. Yes, the trimester, I thought you meant the whole plan. No, the trimester is just for junior high students.
Okay, so it's in the middle of a semester or a
Yes.
quarter. For
Yeah, and
everybody else.
the problem we face, and quite honestly, the things we discussed, we will require all 712 Virtual Learning Academy students to stay in Virtual Learning Academy until the end of the semester. And the reason being for that is this: if we take them out of virtual learning and put them in we don't even have courses that could accommodate those students at this point in time, that would be fair to them, because the academic structure is different. And so if we do it on a fresh break at the semester, we feel that's probably the best approach with 712. And that's 3 weeks. I mean, we're basically talking 3 or 4 weeks. And we just think that the work we've done, that would be almost impossible to accommodate those requests at the secondary level. Staffing wise, it would be an unheard of challenge for us to try to accommodate their schedules. So that's why we're asking to hold off until the semester.
So who wants to go first? I got 4 questions right there. Okay. Okay. The first question that I have is, and this goes back to data, so that we're all singing from the same song sheet. When we look at data, it's very difficult because we know that what we see on Tuesday and Thursday afternoons at 2:00, if you tune in or whenever you tune in, is a much more global, and rightfully so. It's a state of Ohio approach. If we go into our health department that is specific to our county, and we look, because I click on and look at the zip codes that constitute our school district, that's also now on the big,
Correct.
state, on the COVID website. So we've got overarching data and trends for the state. We have very specific data for our school district and our community in general. So my question is, this was the question that was asked of Heather, is to clarify that although we look at the trends of what's going on around us, the actual cases of data, are we just really honing in on our district? Because we've got this dashboard,
Mhm.
and then we also have at the state level, they have given our district their cases. Is that indeed
Yep.
what we're really monitoring?
I'm gonna, Mr. Blackburn, if you can,
Okay,
because he's controlling the data
great.
right now. so
Whoever's
I don't
the
know if you can answer
monitoring
that
of the
question,
data.
Bob. You're muted, Bob. Or,
I'm sorry. Got you.
there you go. Now we got you.
We have been using the district data there. You do have our dashboard. That's a screenshot of our dashboard that we have on the agenda tonight with our data. And you can see, I don't know if we've actually established any trends here. That, we have good weeks and we have bad weeks, if you want to call it bad weeks, but the data goes up and down. One of the other things that we've been asked to do is to look at the number of quarantined students, which we have not been putting on our dashboard. We are going to put that on the board agenda document that we provide you guys at the board meetings. And we do have that I do have some of that data to share with you tonight if you'd like, how many kids have, or how many individuals have been quarantined. And actually, Jody, are you able to speak to this, the number of quarantined students? I'm not for sure if I'm giving the accurate numbers here. And I know you just provided new numbers.
This is Dr. Snowcliffe.
And when you give us that, can you tell us if that's been self-quarantined or directed that somebody else said you need to
No.
quarantine by
What
contact?
we're doing, we're going to just provide the numbers that we have worked with the health department to identify close contacts.
Okay.
And we have, we've asked those families to quarantine.
Okay. So that's health department initiated. That answers a lot of questions.
Yeah.
Great.
And that's why if you remember, we initially started putting that on that document. We had the quarantine numbers on there, but it was kind of inconsistent because we were getting numbers from physicians, we're getting numbers from families, we're getting numbers from different health departments. So we decided we're going to just go with the numbers where we have worked with the Franklin County Health Department to identify those close contacts. So those are numbers that we're going to be reporting to you. So Jody, are you still on here, or you're?
Yes, I am. Hi.
Hi, Jody.
So first of all, our district team has done a great, amazing job of tracking all of these numbers. We report daily our numbers to the Ohio Department of Health. And so we work very closely with one another, always to stay abreast to where we are. So last week, these numbers are quarantined due to contact tracing. So these students were close contacts of other students. So you'll see that at Pickerington North, we had 26, which included athletics. Pickerington Central, we had 29. At Ridgeview, we had 2 students in quarantine. At Lakeview Junior High, we had 5 students in quarantine. At Tollgate Middle School and Harmon Middle School, we had no students in quarantine. I want to say at Violet Elementary, we had 1. At Tucson Elementary, Tollgate Elementary, we had none. At Sycamore Creek, I don't believe we had any, but I want to make sure I'm right. We had 2 at Sycamore Creek. At Pickerington Elementary and quarantine from close contacts, we had 1. We had none from Heritage Elementary School. Fairfield Elementary School in quarantine last week we had 1. And we had none in quarantine from transportation or district office. So as I said, the team at Pickerington is amazing. We work really closely together. And so everyone's always informed of the numbers that we have at the end of each day or every couple of days. So no one's surprised of that information.
And Jody, could I ask a question? I think it was at North High School with the 26. That dealt with a freshman football team, I believe.
It
And
did.
it was no fault of our own. What happened was we had a student from Gahanna, I believe,
It was.
that was positive and played both ways, offense and defense. So basically, what we were told is any kid that was on the field had to be quarantined because of that, because they didn't know if they came in contact with that individual athlete. So that's a little skewed, I think, when you look at that, because we're going to have situations like that when you have athletic teams, unfortunately.
I agree completely.
And God forbid it happened anytime in the playoffs, but it could. And that's just a challenge we face. Even if it's not a student of ours, we have to take those precautions. So,
Chris,
Dr. Brick.
just one real quick. Just to be clear, we're only talking about the people that are in the hybrid now. So the people who are in Virtual Learning Academy would remain in Virtual Learning Academy.
grades 7 through 12, yes. If we have, what we're saying is it, and this is kind of the million-dollar question is we will have spots available at the elementary
That's
level.
another question.
Right, but-
That's another
but-
question.
K6, we will have, if families want to transition, the one thing that we've talked as a leadership team is how do we make that fair? How do we make that consistent if we have, and we talked about doing a lottery system and accommodating as many families as we can. And I know this is a difficult conversation because they did sign up for a year, but if we can accommodate them, why wouldn't we? And I think that's the right thing to
Right, but
do.
if they're K6 or even K through 12, I mean, and they want to stay in the Virtual Learning
They
Academy,
can.
what we're talking about now doesn't impact them at all. Because I think
Correct.
we've mentioned virtual learning a couple times, and I thought people might be confused thinking that we're saying everyone,
Well-
including Virtual Learning Academy people, are all coming back.
No, and we've had very open discussions as a leadership team. We know there's going to be families that are currently hybrid and may not be real comfortable with going full-time, that may want to, explore the idea of a virtual learning opportunity. And we'll have some of those people that are currently virtual that would want to go full-time or come back. And you get the emails too, just like I do, about families that, this is not really what is working for them as a family, whether it's a work-related issue or whether it's a student issue and their success. And they want them to be back in school. And we will do our best as we possibly can. Staffing is always going to be our main priority, and the health and safety, obviously, but the staffing part with VLA is difficult because we do have those teachers that signed up for that. I believe we had 65 total, or 63, something like that. Ryan, is that correct? Close to virtual.
Somewhere between 60 and 70.
So,
Well,
yeah.
that was my next
Okay.
question. And my only question was to make sure that if we let students that want to come back in from VLA, K to 6, because you're talking about,
Correct.
or if we want to allow students that are currently hybrid but want to go VLA for a lack of comfort,
Yeah.
we would allow that both ways to go
Correct.
based on space available.
Based on space and yes,
Okay.
yes, we had that
And
discussion.
you would have, at this point, 3.5 weeks to be able to
Yeah, and we,
resolve that.
yeah, and we talked about that, Lori. We talked about the time frame. We're going to establish that. One of the things I asked Bob to think about and our leadership team is what kind of time frame we're looking at there. Obviously, we want to give families enough time to make the decision, but we can't obviously go right until the 16th. We have to have some sort of date there where we have to have a deadline for families to submit their request.
So as soon as the decision's made, we can survey
Correct.
who wants to go where.
Correct. And we
Okay.
think that'll happen. I think we'll have families both ways. I personally, I guess maybe this is just my own opinion, but I don't think we will have a large group of families from VLA want to come back. They obviously signed up for VLA when we were half-time. So I don't think we will have a large group that will want to come in full-time. They may, just based on their circumstances, but we'll take that all into account.
And then the last question that I had, before somebody else can take the floor, was Heather brought up again our cleaning on Wednesdays. And I wanted to say what at least my understanding was from a presentation, and then ask if you could ask Vince to maybe comment if I'm a little bit off. But it was my understanding when this was presented to us that that the cleaning that happens on a Wednesday is deep only in that it's a second time
Correct.
through in places that are common and utilized a lot, and maybe some spaces that aren't but don't typically get hit in a on a daily basis. So it was my understanding that what we're doing, it isn't like we would need to bring in a cleaning crew and
No.
go through and bleach the walls top to bottom.
And I think Vince will tell you that, I think one of the things, Vince, you can jump in. I think it's just important that people understand we're cleaning every day. We're getting touch points. We're continuing to clean the buildings every single day. The Wednesday without students will give the custodial staff, obviously, an opportunity to get to those places that they may not during the week that we think can be a little more deeper clean. But yeah, the deep cleaning does not mean we're doing it from top to bottom, because we do that every single day. We try to create a safe environment. Vince, is that fair to say?
Yeah, that's correct. Remember, we're just sanitizing. There's no way to deep clean a desk. There's no way to deep clean stuff like that. You're sanitizing, you're getting the germs off, you're doing all that stuff to make sure that the environment is clean and appropriate at that point. So there is no, when you talk about deep cleaning, you're talking, we even inserted the word in the plan, thorough. We took deep cleaning out to make sure that people understood, yes, that gives us a second time on the high touch points, even though they've been touched many times or they've been gone over many times, but it just gives us a second chance to re-clean those things. Yep.
And we're going to, and I'll go back and say it too, obviously we've been successful to this point because we've had our staff and our teachers participate, and we're going to need them to continue to do that and do their part. I really thank them for that because it's, obviously something as a teacher we never thought we would have to deal with, but we do. So I do appreciate the staff's participation as well.
Okay, I don't have any more questions.
You
Go
did? Okay. Two. So,
So maybe I won't have to answer.
Good.
okay. So for our classes that are co-curricular, where we have larger numbers in them, things like maybe art, music, that sort of thing, are we going to be able to still provide that instruction? Are we going to spread those kids out?
Good question.
Or are we going to come up with a plan where we're going to have some sort of space that they can utilize to? Sorry.
Unknown name. Dr. Woodruff, do you want to answer that question?
I mean, at this point, our plan A is to utilize the spaces we have through protocols. I don't know if we've really had the conversation that far to look at alternative space yet. I mean, right now we were just focusing on making sure that we follow the appropriate protocols in the spaces that we have. Outside of that, I know we've been looking at lunches in terms of maybe utilizing other spaces, but for our academic programs right now, no.
And Sabrina, it would be fair to say that that's obviously on our radar though, because we had talked about, especially those classes that are large classes like PE, music, we would have to really take a look at how we're scheduling kids in those areas. And I think Dr. Perillikar has been involved as well and has some ideas, I think, how we can make that work. But it's going to take some planning, and we hope to do that within the next 4 weeks.
And again, how we deliver the content, it may look a little differently than it has in the past because that course lives online with face-to-face activities available still. We're not losing, the online piece. So we have different kinds of choices than if it were just all face-to-face.
The other question, I know we talked a lot about the masks for the staff. And we talked about that parents could get those masks. What if we have students that, one, can't find the resources of those masks, can't afford those masks or something like that? I know we're going to get questions about if those kinds of masks would be provided to those students, or if we've got some that are still attending in person, but are a little bit more vulnerable than others based off of medical diagnoses that we're aware of. Do we have any kind of plan about how we might be able to assist those families?
So at this point in time, I would answer that two ways. Number one, the latest round of masks that we're buying are going to be strictly reserved for our staff. But number two, we have already an existing supply of close to 60 to 80,000 that are coming in increments of somewhere in the neighborhood of 6,000 to 8,000 per month. So those medical masks are, for all intent and purposes, the same thing as what we're reserving for our staff. The only difference is that those medical masks would have had their engineering specs and testing done in China, in a different country, similar to the KN95 masks. Those masks are, for all intents and purposes, just as high a quality and as good a quality as those that would have had those testing protocols here in the States. And in fact, most people, if they probably looked, I know I took my wife to a medical appointment a couple of weeks ago. We were handed a mask when we walked in the door. Who knows the origin of that mask? So we're trying to cover for any kid who would not have a mask or who would prefer a medical grade mask. We have oodles of them, literally. This latest batch we would reserve for our staff. That said, I think most of our students are being pretty good citizens when it comes to keeping their masks up and protecting others. Jody, I will let you also add to, if you can, if there is anything to add to what I just noted.
I would add a caveat to that. So the parents then once the contact tracing was done on the child, would let the health department know what brand and type of mask they're using for their child, because it takes, and I think this team could agree with me, it takes a long time to research masks. And so the health department's the final word on any masks that are approved for that contact tracing. So we would just ask that parents, take a snapshot when the health department would call them. Hopefully that wouldn't happen, but if it would, this is the type mask, this is the SKU number of what their child's wearing, so that the health department can make that determination. Because with the number of masks out there, even just looking on Amazon with medical grade mask, there's a lot out there.
We were very particular with this latest purchase. Jody and Christina Halls, we worked very closely with the vendor to be sure that what we're providing to our staff members would meet the muster of, as Keith mentioned earlier, if you get to that individual, they would not have to quarantine. We don't necessarily have enough of those to give to every single student every single day. Just to get through the rest of the school year with these masks that we're talking about that we'll purchase is going to be on the order of 100 to 110,000 masks. We'll go through about 1,000 a day.
But if we have people, particularly like the families I know that come to the food pantry, who have struggled to just get a mask for them for free and are concerned about whether that mask is even appropriate. That's what if we had a student like that wasn't able to provide a mask or something like that, we would still have masks for them.
Absolutely.
Or if we had a family that was super concerned about a health issue regarding a student and we're worried about their mask, we would potentially have a mask also for them too.
Absolutely.
Yeah, so I think that was what I was just asking. That
Yes.
in unique circumstances, we're going to be able to meet those students' needs to keep them safe.
It is not an exaggeration to say that we will, by the end of this year, have gone through anywhere between 150 to 200,000 medical masks of some type or another.
He's
Now,
right.
That's assuming people grab them and use them. They are available and we want our staff to use them. And we also have available, as I said, a whole separate subscription strictly for kids and visitors that don't have them.
Can we also just make sure that there are some of those on the buses? I know that, our bus drivers are doing an excellent job about reminding kids about their mask before they get on the bus, but some of those kids are going to get on the bus that there's no mask to run back in the house to get.
And I was under the understanding we had extra.
I thought they
masks on the
were.
bus,
Vince,
so-
can you speak to that?
I did call Peterman and ask them if they needed masks, and I too was under the impression that Peterman was good with their mask, but Vince would probably know better.
Yeah, we definitely have masks on the bus. Each bus driver has a box in the front to make sure that they can supply the student coming on the bus in masks. So, and that was from the very beginning. This was talked about months ago, that we had to make sure that the mask was a big item and we had to make sure everybody had them. So that's been on there from my understanding since the very beginning.
And Vince, it's fair to say transportation is a topic of discussion as well, because we know when we do this model of pushing in, we're going to have the challenge on the buses of the social distancing as well. And we want to make sure that our kids wear their mask and that they're, appropriate on the bus. That is going to be something we're going to have to monitor.
Correct.
Are you done?
I'm done.
Before, you'll go next, but before, Vince, you turn off your mic and then forget how to turn it back on. Can we remind our bus drivers to wear their masks as well? I probably get a message or two a week.
Yes, and let me talk a little bit about this. Remember, the bus drivers forward most of the time going down the road. And, if they have glasses, they're allowed to pull their mask down because it will fog up their glasses. Anything that impedes the driver at all, they're allowed to handle in that situation. So just want to make everybody aware of that, because I think that's a misunderstood thing.
I know that makes sense.
And most of the drivers I passed have their mask on, or at least have them on their, so when they do stop. So
Correct.
I know some of them, they do pull down for that reason, but most of the ones I've seen have been wearing their masks. But
Most of the bus drivers are wearing masks. They've been very good. I've seen them going down the road, but they are allowed to make sure their driving ability is not impeded at all.
So, and they do wear them when they are picking up students and dropping students off or having conversations with moms and dads. I had a conversation with Peterman myself, and they do have also documentation about the safety of if their drivers wouldn't be able to wear those masks while driving. So there is documentation that Peterman has with them, but we do have to look at the safety of them driving, I think, with their glasses fogging.
Yes, Kathy.
any other questions? Keith?
Well, first of all, I want to ask real quick, make sure I understand, circle back around just real quick to the students going one way and the other between the VLA, the hybrid or whatever model. Did you say that we might even allow this before the end of the semester, or we're gonna just close it till the semester's done and then start next year?
K6, we could probably accommodate the VLA transfer. But 7-12 is where we have the problems with scheduling and staffing. So the 7-12 would have to go until the end of the semester. If there's families that are really adamant about the K6 approach, we would be able to at least take a look if space is available for those kids.
Oh, bless you, because I would have said no. Not till
Well,
September.
K6 has a little different approach too. The curriculum is different, obviously, and it's more something that we feel, and Sabrina, if I misspeak, but I think it's something that's aligned with what we're currently doing more so than the 7-12 model.
Well, I think it's great that you're trying to do everything you can to get kids in school and accommodate the parents and accommodate the families and make everyone comfortable, because you need to be the teachers, the students, and everyone need to be as comfortable as possible, feel as safe as possible to be able to learn and teach and all those kinds of things as possible. So I think it's great that you're trying to do. I just wanted to make sure I understood what you said. Another thing I wanted to maybe just point out, I think in the room, we're okay, but to people is that because of all the work that the teachers and everything is put into this and stuff, if we have an outbreak at, okay, like you said, Ridgeview had a basketball game, blah, 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 and now there's 200 kids, and we have to shut Ridgeview down. All the other schools could still operate. And even the other junior high can still operate. And so I think that's
And Keith,
worth just make sure.
Not to interrupt you, but I think
Go
that's
ahead.
an important piece. I think if people go back and revisit our flexible 2.0 learning, flexible learning 2.0, we have all of that in place. That's the great thing I said about our plan. It's 57 pages long, but we address pretty much every scenario we're going to face. And that's a very realistic situation, Keith, that we may have a building that we have to do red and do all virtual, or look at a hybrid or whatever we have to do to make it safe. But we may have those situations with our 15 buildings. So.
Okay. My first couple of things are just to clarify things I've already heard. Then the next, you said November the 16th.
Correct.
So that week would be a Monday, Tuesday, Thursday, Friday.
Correct.
So that'd be 4 days. And then the next week is Thanksgiving. So it's just Monday and Tuesday, correct?
Correct.
7, yeah. They'll have 7 days before
Okay.
break.
6.
6.
Yeah.
So that's six.
Six school
You
days.
kept saying 7. and
Sorry,
that-
6.
You kept saying 7, and that's what got
They
me
skipped
confused.
out Wednesday, yeah.
Okay,
Yes.
and then the
But
phone-
Wednesday is a virtual day for students though. So it is a
Right.
learning day.
Right, but it's not, you
It's not
know
in
what I'm
person.
asking.
Yep.
And then December is 4 days that week, and then 4 days the following week, and then we hit break, if I'm looking at my calendar correct.
I think you are correct.
So I just wanted to make sure that anyone listening, if they have any questions, that is currently what you're proposing
That is correct.
anyway, as far as exactly how it matches the calendar.
We view it as a type of, if you wonder where it came from too, it's almost a type of ramp up. It's a type of recognition of getting started, taking a breather, checking it out at Thanksgiving, getting back in session, having a breather again at winter break, making sure we're all on the right path, because ultimately our hope is can we be everybody back 5 days a week, second semester? Which is what everyone, no matter what happened from day one, and no matter how many folks were out front tonight expressing some of their thoughts and views, I'm not sure anybody ever felt like that we would be in this mode for an entire year. I think we all kind of felt like by second semester, but we understand.
And again, Keith, I think, you know, I hear our teachers and I hear their concerns, and I know the health and safety is a big issue for them, and it is for all of us.
Yes.
I don't want to dismiss that we're not concerned, because we are going to do everything we can to keep our staff and our kids safe with this model. And it's, you know, I think it's important to point out that, you know, we're going to do the best we can, but we also know that this is a very contagious disease, and, you know, we're going to have some cases, and we'll just have to do the best we can when we implement this plan.
All right. Yeah, well, part of this is just to make sure that I'm trying to clarify some
Sure.
things so that I'll eliminate 100 texts from Kathy. So I'm trying to help her out. Anyway, so then going straight into that, speaking about some of the things that Heather brought up, because I think it is, like you said, it's important. It's important to the teacher. The three things, I know she had 5 or 6, but the 3 things I wrote down that I wanted to make sure that we hit, and we did hit the contact tracing.
Yep.
And how the masks and how that, I feel like we've hit that and we've clarified that. The deep cleaning piece, Vince has addressed that. And I wanted to talk, another piece of this is the fact that the odds of you getting COVID off of that desk, it's nowadays they're showing that is much
high.
less than what they originally thought back in
Correct.
April and May and stuff. And that I want to hear from Vince that once we go, let's say we decide to go 4 days for the rest of the semester, Vince, do you have any concerns that of being able to have the school clean even when we are in school with all the kids on Wednesday too? I'd like to hear your response to that, please.
Well, Keith, I think you hit it on the dot. The CDC guidelines that were just recently released not too long ago had indicated that the chances of getting something on a contact surface was much less than originally anticipated, I guess is the best way to put it. The second thing to talk to you, yes, we would go back to most likely our regular cleaning schedules, and rotate and move them forward. That's to say, like any field, like just like on the teaching side, we do have occasions where we need subs and stuff like that. And sometimes those are hard to come by, but so far, so good. So just want to throw that out there as, one of the caveats, but we're dealing with it just like you are on the teaching side. So that goes without saying. But I think those address the 2 issues you're talking about, Keith.
Okay. The next things are a little bit, I don't know the total answers to these. One thing I did say, I know we all know that we get all the kids in school, there are going to be certain situations that the 6 feet is impossible, but there are ways of containing the 6 feet. You
Correct.
mentioned about New Albany. I'd already thought about that. If you're in the same seat in every classroom, if you're in those things, I think it would be helpful at the next meeting that we communicate. Again, we talk a lot about communicating, that we communicate what are some of the steps so people can actually hear the steps that we are going to do in these classrooms, in these areas, what Vanessa had asked about, in those areas, so that we have a clear, so the people that's taken the time to listen to this meeting,
Yes.
and the 10 people they're going to talk to, and the 10 people they're going to talk to, that it is explained to them how we understand that is our biggest challenge.
Yeah.
On the buses, in the school, in the classrooms, that while we may not be able to maintain the 6 feet, we can contain the 6 feet, if you will.
And Keith, if I can comment on that too, I know that was one of the concerns that was brought up by Heather, is the CDC protocols. And I will say this, really the social distancing is the biggest challenge. There's no doubt about it. But at the end of the day, we are still following CDC protocols. We are still wearing masks. We are still washing hands. We are still doing everything we possibly can to follow those protocols. So we're not ignoring them, and we won't ignore them. But there are going to be some challenges with going back that it's, not going to be ideal when you look at social distancing. But like you said, we do have plans in place to hopefully accommodate some of those situations. And the other thing too, I don't mean to jump ahead, but I did want to talk about the task force because Heather brought it up. I will say this, the task force was established to develop the plan, which we have a 57-page plan from our task force. Could it have included more teachers? Absolutely. But we also have a committee of 22 people, and that's difficult to move decisions forward when you have 22 different people. And we had the union president there from both PSSA and PEA. So we did have that representation. So it's not a perfect system, but the reality is once we develop the plan, and I'm talking to them tomorrow, we have another meeting, the actual implementation of the plan is ours. I mean, we have to do that as a leadership team. And that's what we talked about was it's not, I never intended for the task force to take on the implementation phase. That was just too much. That's what we do. The day-to-day operations, the management, the setting up that plan is what we wanted to do as a leadership team. And the task force did a great job of developing the plan. I mean, it's 57 pages long. It covers pretty much everything that we're looking at: green, orange, yellow, red. If we have to go to that status, we have it covered. So I just wanted to go on record and say that it could have been done differently. Absolutely. We would have had a larger group, but the end result would have been the same. And I think it's a good plan that we have in place. So thanks.
So I guess that's actually my last question was, can you elaborate a little bit more? Like, who is involved? Who are you trusting? Who's making, because that committee we have a couple members on that committee, and you guys meet once a month or something along those lines, maybe. I mean, they can't be brought together every time there's an outbreak. Oh,
No.
should we close this school or should we open this school?
No. And
So
I think,
what is the decision-making
well, I will say this.
system look like?
Yeah, and I'll say this, Keith, and I just want to make sure that the task force was never designed to do that. They were never designed to call them together when we had an outbreak. The idea is that we developed the plan, and then obviously with that plan, if we do have an outbreak, it's, we're going to have to get together with the building administrators, everyone that's involved in the decision-making process, and implement one of those things from the plan. So I never really intended for that committee to be involved in the implementation. They've got too much on their plate anyway. There were, they're teachers, we did have some health officials involved, not as much. Kathy had a great resource for us that we used when we needed to, and she brought some information forward to us. So yeah, I want to go on record and say, yeah, I mean, we could have, made it all teachers, but I just don't know if that would have met the needs of the entire district. And so we tried to do the best we could with the group that we had.
But so if I'm a member of a staff, or that they know who they need to talk to, who's represented in your meetings.
I would hope so. Yes.
Okay.
I would hope so.
I
Yes.
just want to make sure that's.
And that's why we included Kathy and Vanessa too.
Because again, I'm trying
to.
I think it was important. I think it was great that Heather showed up and stuff. And I think we need to. And I feel like a lot of what she brought up, I feel like we've
Absolutely.
We've addressed.
Well, and let me address this too. I think Heather was going by a 5-day-a-week plan instead of the 4. That's what she was talking about. That was original part of the conversation. And then tomorrow we're going to share with the task force that this is our recommendation, was the 4 days with the Wednesdays. And we think that will help our teachers, maintain some stability for at least the end of the first semester. So it is a little different than what she originally heard. So I think she was speaking from that 5-day-a-week all in, instead of considering the Wednesday.
That's what I had.
So Chris, nothing's changing inside the building, correct? Like as far as traffic patterns, all of those things that the kids have already been doing. And are used to, none of that is going to change inside the building on a daily basis.
And the one thing we'll have to do, Clay, is at the high school level, we'll probably have to put that, they do it now at the younger grades. They have one-way hallways. They have, and we'll have to do the same thing at the high school levels. Now they can do it, I think, because There's so few kids in the
The
building.
hallway right now, they're split in half.
They still have the split?
They do
Okay.
still have the split, and,
So we'll continue that, yeah.
well,
Or make a,
so I suppose, Vince, you know our capacity is probably best. What is the feasibility of one-way hallways at either of the high schools? Is that something that we would have to just keep our continual left-hand side of the hallway, right-hand side of the hallway?
I think we'll have to continue to kind of brainstorm on how we want to look at this and how we do it. And we'll get with the principals this week or next week to determine how this is all going to work.
I'm going to guess that's one of the
Just like the large cafeteria spaces that Sabrina was talking about. You know, those are areas that we'll have to continue to talk about how we spread people out, how we make spread them out into gym spaces or field houses during lunch, or the options we're kind of looking at. So we just got to make sure that we're looking at all that. But I think it's another walkthrough with the principals to make sure that in each one of their buildings, because they're so different, Ryan. I hate to be carte blanche and say one thing about any particular building because they're all so much different.
But there's at least considerations to using different parts of the building than what they're normally used for.
yes.
Absolutely.
Yeah, and that's what we were talking about today, kind of as a leadership team during cabinet is what does it look like at a lunch period? It's going to have to look a little different. I mean, whether we spread them out, we use, rec centers, we use whatever space we have available to do the best we can to keep kids spread out.
So I'd like to read at some point, and I think I was just kind of putting finishing touches, Clay, on. I've written, we are aware of challenges with large group settings like buses, class changes, hallways, lunchrooms, co-curricular classes, et cetera, and we'll be working to meet those challenges. So the school district, something I've been, if and when we get to a point where you'd like me to read what I've heard as I've been typing conversation, I could read it back to everybody.
And so let's say, for example, I mean, I know we've had issues in the building, but how quickly are we prepared to pull back if necessary?
It's a great question. And part of what we're looking at right now is, I'll just use Hilliard as an example. They have a great plan and they're working with Ohio State and we're going to be part of hopefully that initiative. It's called a CAS, and basically it's data-driven thresholds. So they have a percentage, and I don't think we'll get there, but they have a percentage for students, a percentage for staff absences, and then they have overall district. And what they do is that's how they go between their models. So I think what we're going to develop as a leadership team is what does that look like if we have, let's say Tucson Elementary comes down with 6 cases. Does that mean we have to move to, orange, yellow, red? That's what we have to determine between now and November 16th. But that is part of our conversation as a leadership team, is what that looks like for each building.
And you said that's through Ohio State?
Ohio State has the program. And when I talked to Alex Jones from the Department of Health, she had put us in the hopper. So we are going to be one of the schools that they can work with. And I just need to follow up to make sure that they put us on their list. And they provide a lot of data to school districts throughout Central Ohio. So Clay, to answer your question, it's a work in progress. And, I'm sure we'll have something in place that, looks at each building separately and what we can do to, because we are going to, I do think that's a challenge for all. As I said this at the beginning, when we started in our hybrid model, I won't be surprised if we hit one of those collars as a district, different buildings during the year. I mean, it could happen really quickly.
And if, sorry, I lost my train of thought. I apologize.
All right.
Okay, and you said Franklin County Board of Health is also linked with that Ohio State program?
Correct. Yeah, they work closely with them, and I think they're responsible for kind of pairing up school districts with the data that they provide.
So let me ask you this. So how quickly is our turnaround? If we're notified, how quickly are we in touch with Franklin County Board of Health?
No, which part of that? That notified that we have an outbreak or that we have a case?
That we have a case.
We're in touch with them usually within 24 to 48 hours, or the flip-flop, and Jody and Christina can speak to this. The flip-flop is what can be difficult. If someone does not get identified for a week or two, it's normally because we get a call from the Department of Health that says,
What have you?
we've contact traced and we're to the point where we're talking to the district. And we have an individual that this past Sunday may have tested. But usually when we know, we're,
Right away.
Jody, am I writing checks that we can't cash, or is that accurate?
No. So when we find out a student has tested positive or is a probable case for COVID, our response time is less than 24 hours. As he alluded to, we can't control if we find out 2 weeks later from the health department gives us a call and says, hey, 2 weeks ago, so-and-so had a positive case or a probable case. Those are our only delays. When we find out that same day, our students are getting phone calls if they're a close contact from our nursing staff and our administrative staff. We send them home a letter with the quarantine date and then what to expect from here on out. We send out classroom letters that day. And then we also send out building letters just so we're transparent with our community. That's, I think, the biggest thing that we want to be is transparent. Hey, you're going to see on our dashboard, we had a case. You're going to see it on the ODH site. And then the classroom letters just mean that your child's not infected. They haven't been identified as a close contact, but they were greater than 6 feet. They shared a same classroom space with this individual. And then the close contact, if they've been identified and they need to quarantine, then we call them and they get a letter sent home with them of what steps to take. So you are right. Our staff is doing an excellent job. And it is not an easy task to contact trace, trust me.
Would you like an example letter forwarded to you? Here's a perfect example. My sons go to North, and I got a school letter.
Okay.
Yeah, I think we've got.
Okay.
Can I request that Jody, that you or someone email the board every day with the daily positive counts? We've gotten some letters, not all. And that dashboard is, if you could email us every day, simple email, cut and paste,
Yes.
000010000. I mean, the communication of the board's been inconsistent on that.
Well, I don't understand. We're getting a dashboard every week. Are you saying the dashboard is not accurate?
No, our dashboard is accurate, and we, Bob, Christina, I, and Jill Amos, we have taken extra steps to make sure that that dashboard is correct by using a jot form. So everything in that dashboard is right. And we have like all of our eyes going over this dashboard all the time, but I want to make sure that our communication with you is effective. So I most certainly will send all of you an email. I don't have a problem with that at the end of the day. Do you just want to know our positive or our quarantine numbers also?
So every day, even if it's,
That's right.
okay, just want to be sure.
So we're creating work for people.
Is there any other questions from board members?
Yeah.
Yeah, I just want to summarize where we're at before I kind of ask some more questions. So the recommendation from the administration, and this is slightly different than the recommendation that you brought to the task force last week,
Correct.
which the administration brought.
That is correct.
Okay. Is to go back on Monday, November 16th, Monday, Tuesday, Thursday, Friday, all in. All hybrid students will go Monday, Tuesday, Thursday, Friday. VLA or Wednesdays will remain a cleaning and staff.
It'll be a virtual learning day. Yeah.
What we're doing now.
Yep. It'll be consistent with what we're doing.
So we'll go 1 week for 4 days. The next week is Thanksgiving, and we'll go 2 days, have 3 days off. Then we have 2 weeks or 3 weeks,
3 weeks,
3
I
weeks
believe.
in
3
December.
solid weeks in December.
4 days of instruction
Correct.
for our hybrid students before we're off for winter break.
Correct.
And then on January 4th, we would come back in what fashion?
Well, that's to be determined.
Okay.
And I think that's the the question that we have to ask ourselves is how things are going. And that's why we made this decision to look at November, because it does give us some time to see how the plan is going. And I said this, and I always use this term and people roll their eyes, but if things go sideways in a hurry, we still have our plan in place that we're currently doing. We've done virtual. We can pivot pretty quickly. But I think those 3 weeks and those 4 days are going to tell us a lot.
I think the struggle for a community member when we say we can pivot pretty quickly is that maybe the community cannot.
I understand
And
that, but we're going to have to make decisions. And that's part of the COVID-19. I mean, unfortunately, if we get cases, we're not going to have an option when we have to make some decisions about buildings. And I hope the parents understand that this is not going to be a fluid year for anybody. I think that's the biggest challenge we face, Kathy. I agree with you, is how we do that and how quickly we do it and how long we do it. That was kind of Clay's question too. Those are going to be things we're going to have to work through.
Well, I think there's two sets of stakeholders, three if you add the students, but they're by an extension of the family.
Yeah.
And while we may be able to talk ourselves into a comfort level that our staff can pivot quickly, we need to be very sensitive to our working parents out there who have made a lot of sacrifices and a lot of adjustments for instruction for this year. And I would hope that we are not cavalier in pivoting because we just made some perhaps reckless decisions up front. So let me go back to clarity before I kind of go on to where I stand. You had mentioned other districts, 40 some odd percent in the
I guess up to
districts.
45%, Ryan, would that be accurate that we were looking at the data? Somewhere around 45%.
Do you know what the largest district is?
I would tell you just the comparable districts I looked at is Mason and Lakota. And Lakota is one step above us. They have, I think, 12,000 students, or
Lakota's closer to 22 or 23.
are they that high? And they were all in from day one.
The schools double our size, or
And Mason has
never
done it
been
as
the
well.
hybrid model.
So Mason and Lakota and
Yeah,
us.
and I'll tell you what, if you really want to see a district that is doing it right, Mason, Brian can tell you, they put out a lot of data to their community. They support everything they've done. And they're very student-centered about how they're reporting it, and it's been working. And they actually put out some research that says they've had less cases with students because of what they're doing. And so that's a district that we can model after, or at least, I'm not ashamed to say, we'll look at how they're performing and what they're doing.
Have we?
We have, yeah, I mean, they put it out there. Am I correct to say that, Brian?
So do we know what other districts are using the medical grade surgical masks?
I don't know.
I don't know that they even are. They may just simply be viewing it from the perspective that as long as everybody is masked up. Remember, the Ohio K-12 guidelines from the start encouraged and strongly recommended 6 feet social distancing, but knew that schools couldn't start if it was an absolute mandate and requirement. So I don't know whether they've got the medical masks or whether they've just simply said, everybody will keep masks on, and they've continued to progress.
Do we feel guilty in any way in buying medical grade surgical masks that are technically designed for the medical world?
No.
And removing that
Jody?
supply from the chain?
I do not feel guilty at all. And other school districts would be doing this too if they had been able to. And I tell you why I don't feel guilty. Because our teachers and our nurses and the rest of our staff are frontline workers. They are considered at this time to be frontline workers. And I guarantee you that a kindergarten, especially elementary spec ed teachers, are working more closely with students than I would be in an acute care setting. And I've had many, many years in an acute care setting, and I've taken care of tuberculosis patients a lot. And what I did was cluster my care. So I watched how often I would go into those patients' rooms. So I think it is of great importance to me. My nursing staff is excellent, and I need to keep them healthy. And they are working on the front line, just as if they were in the urgent care ER.
Yeah,
as
I guess
well.
I'm not quibbling about our nursing staff, Jody. I just, look, if you guys don't feel guilty, then that's fine.
don't.
I'm just coming from a different perspective. And I know that when the country shut down and hospital and medical settings stopped doing elective procedures, it was to preserve the PPE. But if you guys feel that that's, if you can justify that, then I'll move on.
Absolutely. And I would say I would support what Jody said. I think our teachers are considered frontline workers and they're exposed just as much as anybody else. The other thing too, Kathy, we would never be cavalier on any decisions we make. Obviously, this is important and we would never take anything lightly making that decision.
So the other clarification I have is regarding the transition from November 13th to a 50%, really it's 40% because 20% of our kids are in VLA, to move to an 80% capacity in every classroom. Is that enough time for our staff, particularly our custodial staffs, to transition those rooms and get them ready to go? And
Great
it's
question.
certainly not going to be 6 feet and probably
No.
not 3 feet in many instances, particularly when you talk about
Correct.
things like band and
Correct.
PE.
Vince, can you speak to that? We actually even talked about that today. Is he off? Okay, we talked
We
about
did.
that very thing today. Oh,
Vince, did you run back?
were you able to catch that one, Vince?
I'm back.
Vince, Kathy asked a question about
Okay.
classroom furniture and how quickly we can get that set up. We
I-
talked about it this morning.
Yeah, we talked about this morning, Kathy. The classroom furniture in some cases were put in the corners of the room so they could move them fairly quickly if this did happen this way. You got to remember all the furniture is in each of the pods, so it's going to be quick and easy to get to it. I'm going to say it's going to take a while to put the desk out. You know, the custodian's going to have to move everything around, but if that same thing, that can happen.
Are we planning on surveying the parents at all, or are we just going to make a decision and go with it?
Well, I mean, that determines if you want to survey the parents, we're going to have 50% that we know once their kids in school and 50% probably want to continue what we're doing. So we just have to determine what decision we're going to make as a board and as a district.
Okay, so we're not going to
I mean,
survey the parents.
No, I
Okay.
don't think we
I would venture to say it's got to be 75% of parents
want their kids in.
But
I don't
aren't we
think
kind of
that's a problem.
surveying them when we ask people if they want to go from VLA in or
Yeah.
into VLA space available? Isn't that surveying parents to say, are you comfortable? Would you like to
Absolutely.
consider this? I mean, we kind of are going to do that.
We can do that, Brian.
At least K to 6. You were talking about 7 to 12 has to stay
Correct.
because of scheduling, but
Well, and that's going to be
Is that right?
obviously it's going to be a crucial point for us. And we have to
Okay.
think about how we want to get that information out to those families, because I don't know about you, but my experience with this district is parents don't have any, there's very little, I guess they'll give us feedback if we want it. And they've always been able to reach us. We've been open, whether it's through email or calling our offices. And I think we get a lot of feedback on our plans through that, whether we do a formal survey or not. I know they've always been receptive about reaching out and telling us what their concerns and what is working and what's not working.
we saw a sample of one building survey, I think.
And buildings are doing surveys for
Some of them
virtual,
are
which
surveying.
good for them. I mean, it's really good data that they're actually gathering to help those families. I think that I look at Brian because I know it's his office, but I think the buildings that have done the surveys have used that data to support their families. And they're actually, I think it's good because our VLA families sometimes feel not connected, or if they struggle, you know, they like to know that they have somebody they can turn to and get some help. And I think those buildings have done a pretty good job.
So we've all listened to the community for weeks and weeks and weeks, whether your community is as a parent or a teacher or a bus driver or secretary or business owner. What I'm hearing, what I have always said is that this is a balance in achieving two goals. And one of those goals is the safety of our staff and students. and the other goal is instructional excellence. I think we're doing very well right now with the safety of our staff and students. I mean, kudos to the community. I think we're doing a pretty darn good job in achieving the goal of instructional excellence. It's not perfect, but I would place the safety of our students and staff over that, candidly speaking. I am not of the opinion that we need to shut down. I never have been. Stay in our house, shut the door, close the windows, stay there forever until no viruses exist on this earth. But what I see in our school community is a settling in to two instructional models that are working okay. Pretty good in some instances, really well in other instances, not so great in others.
Yeah, for some.
But what I hear is that we're there. Parents are like, took us about a month, but we're there. It's good. I'm okay with it. So even the teachers, took us about a month. This is what people are telling me. I mean, I'm not hearing everything. And they are, quite frankly, the majority of people that I'm hearing from are not interested in going back right now. They're interested in letting things roll until the end of the first semester. They know it's not perfect. And we don't know what second semester is going to bring. But I guess for me, in listening to all the feedback and the comments that I've heard, is that we have medical professionals, including the one that's consulted with this team, reopening task force team, who is a member of the section of school health of the American Academy of Pediatrics and a well-known pediatrician in this community, who, when he consulted with his peers, said, you know what, do what you can to keep those high school kids separated. We got 2 high school buildings with, if you take out the VLA students, anywhere between 1,500 and 1,600 kids in them. That's just too many kids in a building, in my opinion. It's a lot of kids in a building. We've got new NCH, ODH guidelines that are crazy. I mean, if a kid has the sniffles and a cough, they're sent home. And they could just have a cold. I mean, we've already experienced it. Mm-hmm. And that same pediatrician, it's driving him crazy too. We have OHSAA guidelines that are restricting visitors at football games to, is it still 15%?
15%, yep.
But we want to bring our kids back all in, 80%, because 20 are in VLA. We want to bring 80% of our students back 4 days a week.
Correct.
On an arbitrary day in the middle of November. I understand it's the end of the first trimester. In addition to that, cold and flu season hasn't even started. Well, it's kind of started. Flu shots are available. But we don't know what the unknown mystery is of the triple whammy of cold, flu, and coronavirus seasons. We don't know what that's going to look like. Maybe a non-year for the flu. It may be a hellish year for the flu. We don't know. I'm personally not too concerned about spikes in the COVID-19 cases because we're going to get spikes and we're going to get deep dips. But what I'm worried about is the trend. And it's the combination of all 3 of those viruses. Now, we don't know, but I just feel that it would be a reckless decision to bring 80% of our kids back into the buildings 4 days a week when we haven't even done sort of a phase in, which is actually, after all my jibber jabbering, is my proposal. That we bring our K-6 kids back using your schedule for the rest of the year. Why? Because those kids are in their own classroom. It's going to be adding cohort A with cohort B in one classroom. They basically, other than going to PE and lunch, they don't travel the building. Keep the high school kids on the hybrid model until the end of the year.
Just the 5th and 6th grade do. They're middle school.
All right.
So they share teachers.
Okay.
So,
but don't they, I mean, when my kid was in middle school, you had a divider wall that you just opened up, right?
well, I don't think so. I think they share classes. They go back and forth.
Okay, so maybe that's changed. Anyway, so go to K4.
Yeah. Pods.
But my proposal would be to phase in the younger kids first, the ones that don't travel
Mhm.
or don't travel a lot between classroom, and to classroom and keep those secondary kids home until January 4th, whatever day we come back. I really struggle with the proposed schedule because I don't understand the rush to bring everybody back in 4 weeks. I just don't get it. I just don't get it. Why can't we? I would prefer that we phase some of our kids in.
Well, let me just comment on that, Kathy. I don't mean to interrupt you, but as much as you're hearing families that like the current model and want it the way it is, I've heard, and I don't want to say 75% because that's probably high, but we have a large portion of our community that wants their kids back in the schools. And I'm not saying we're doing it just for the sake that they want them, but I think there is some validity to the damage that we're doing to kids right now. I mean, they are not getting, as much as we say we're doing the best job we can, and we are. We're educating the best we can. Our teachers are busting their tails. They're working hard. We're doing the best we can. But at the end of the day, they're not getting the same education. And
I agree.
I struggle with that because they're falling behind.
I agree with that 100%. And I will also agree with your first point, which is the social emotional health of our
Absolutely.
students and staff.
Absolutely. We heard it out
And
there
parents.
today. Absolutely.
But I guess where I'm at is that I would prefer to see a phase in and not an all in at once. If we can prove with our younger kids who are pretty within reason, they stay in the same classroom and they don't have a lot of interaction with other students, and that becomes a brand new cohort C, which is A plus B equals C. And I will almost guarantee that we will probably not see a lot of change in numbers. But let's prove it to ourselves instead of just jumping into the deep end.
No, and I want to share with you, that is a consideration all of us considered. It was a plan that we looked at, the phase-in approach for younger kids. But the reality is that's not going to help the 7 through 12. And it's not going to address any issues we face 7 through 12. So, and it's, to me, it's much less disruptive doing an all-in with K through 12 than it is to try to phase in elementary. And the reality too is when you're looking at transportation and other issues, that creates a lot of concerns about how we're going to make that happen with the K6 on a different schedule from 7-12. And I mean, I can't tell you that it wasn't an option. I can just say that we thought that if we're looking at the overall program from kindergarten through 12th grade, it made sense for us to try this and to do this with 4 days instead of 5 days. And we still have that 1 day built in. So even if we go all in with our elementary level kids, I just don't see how that's going to give us the data because 7-12 is nothing like K5. So even if we get positive data at K5, I know, for example, that we're switching classes at the 7-12, and those days are not going to look alike. So I understand what you're saying because it would give us good feedback how we're doing, but the reality is those two educational deliveries models are completely different. And I think we're just going to have exposure at the secondary level. I mean, we're just going to have, the kids are going to be traveling. We have to monitor that in the classes, but it was a consideration. I'm not going to lie to you. We talked about that as a phase-in approach, but we decided that this at least accommodates all of our kids and not just.
Just to clarify, and I'm beating a dead dog, the administration talked about this, right?
Yeah, that's our job, Kathy. Yeah, that's what we do. We make decisions that after taking some input and feedback, and yeah, as a leadership team, we have decided this. But it's
We're recommending it.
We're recommending
Certainly,
it. That's right.
whenever you're ready,
Board to
I
approve
can kind of
But,
type up what I thought I've heard or.
well, I think we've all heard what we've heard.
Okay.
I just, and maybe people want you to read a list, but
I guess I guess maybe I should clarify, Lori, what I'm saying is as Chris read his notes of the formal pieces of the recommendation, I just was trying to codify that is all I was trying to do.
But I want to go where Kathy was. I initially was of a very similar mindset that we know that K-6, there's a lot less movement in a building throughout the day than there is 7-12. So in my mind, K-6 would also be the typical grades where people really needed to do planning for childcare.
Correct.
So we all agree that that's the most planning as far as on the parent side.
Absolutely.
For K-6. The most planning on the school side is going to be 7 to 12. So I kind of thought the same thing, that we've got a lot more people moving around 7 to 12, definitely 9 to 12. But we also know that you can pivot quickly 9 to 12 because we don't have parents looking at childcare needs and scrambling for childcare. But the other thing I looked at, and this is why I asked about the data, was I went back to a couple districts that I knew for sure. I didn't look at New Albany because I didn't know when they went full in.
It was recent. It wasn't at the beginning of the school year.
Okay. But I knew that Granville and Newark were both full in and have been that way for at least 2 to 3 weeks. Granville's been that way since the beginning of the school year. Because what I was interested in was, even though they're smaller school districts than we are, it doesn't mean they have any less number of kids in a classroom because they're just going to have less total classrooms. The average classroom size is probably going to be very similar to what we have. 20 to 25 at the elementary, 25 to possibly 30 up, at high school. So I was just kind of trying to, even though I can find I can't make statistical relevance because it's just raw data. We had reported on the state site 14 cases. So I'm looking at, that must be the time period they've looked at since school started, not prior. And at the same time, a school like Granville and a school like Newark have 3 to 4. So in my mind, I know we're not avoiding cases, and that's what we have to get past. We're not avoiding cases, but the fact of the matter is we probably have kids right now that are asymptomatic that would have no reason to get tested unless they were exposed or a family member or someone was. So for me, that was part of my mind, getting past the actual numbers or the potential of believing that we could avoid anyone getting exposed. So then I went to the masks. And to me, the single biggest factor is going to be the masks that either we provide on the adult side or that we have available for kids on that side. So I feel like we can pivot 9 to 12 fairly quickly, because that's also where we're probably going to see the most fluctuation, more so than maybe K to 6. And it was kind of a switch in mindset of believing, how can we try this without phasing it in, to understanding that for 9 to 12, we can pivot pretty quickly. And that's where most of our fluctuations probably going to be. But again, we are not scientists. None of us are, or statisticians. Maybe Ryan is, but I just trying to look at something to compare ourselves to people who've already tried this. And the numbers aren't high, but I think they're probably trying, just like we are, to make sure all of our staff are safe.
Yeah. And
knowing that as long as we have our kids wearing masks, we're doing everything also to keep our kids safe. So I was where Kathy was, and then I kind of had to
and we were
switch
too,
a mindset.
to be honest,
Yes.
we were too. And we talked about the phase-in approach and what that looks like for our district. And in my opinion, I think, yes, we could do a phase-in approach and we could do it very well. I have no doubt that if we did K6 or K5, our teachers could handle it and our staff could handle it and we would do a great job. But I still worry about our 7-12 students. I just worry that we're not providing, we're doing the best we can, but they're still struggling. And whether it's the social and emotional piece or whether it's the academic piece or whether it's the family dynamics, I don't want to dismiss that, because even some of our older kids are struggling with that. When we talk about, and I mentioned it in here, to be honest with you, is the resources. Brian can tell you, yeah, we provide, like we said, we provide kids with the tools, but at the end of the day, if they don't have connectivity or if they don't have parents that are supporting them at home, they're just missing out on what I think they could get by being in person. And I know everybody agrees with that. I know our teachers outside today want our kids back in school. I understand that. And we still got to do it safely. And that's what we're trying to do.
I would just say, that I commend you, Chris, for being flexible with the plan, in that we're saying if we can accommodate those who don't feel comfortable with this, and looking at a VLA option for them,
Yes.
and even accommodating those that are in VLA that might say, this is a little bit more structure that my student needs
Correct.
now. So the flexibility, I just want to commend you for.
Thank you.
Just to clarify, then, you are going to open up the opportunity for VLA students to switch back?
If there is spots, and that's the
And
one
how
thing.
will we, do you
Well,
know
and that's
how?
the one thing that Dr. Howard is working on and Bob is the amount of sections that we offer. Obviously, staffing is critical. We can't just flip-flop staff between VLA and in-person all the time, and I think that's a challenge. But Zach, do you want to talk to that for just a second?
Yeah, thanks, Dr. Briggs. What we know is that there are certain, within the homeschools, there are certain seats that are available by grade level. And what we would do is recommend that we'd be very transparent of saying, we have these number of seats available at these grade levels within these buildings. And then we could allow families to enter into a lottery for those available seats.
I don't think Kathy will be able to accommodate all requests, but we'll do the best we can.
And board members, you do have the most current enrollment. So and with that, you see the number of seats that are available per section in each one of those classrooms. Obviously, the secondary level is a little bit different. We have to look at the individual schedules of students and what space we have available in those classes that they have requested.
I just want to clarify. I've heard we're opening it up for VLA students K-6 only.
Yeah.
And now I'm hearing secondary as well.
No, he didn't say that.
I think
We're
we
not
said
open.
secondary at the weeks. If we
At the
can
end of the
accommodate secondary during the second semester, we would look at that as well. But we would open it up for K-6 starting November 16th.
And 712 VLA will stay in until the end of the semester. Honestly, that's the only way we can make this work. If we open it up to 712, we have staffing issues, we have scheduling issues, we have, you look at what the kids are taking, and I'm not even so sure we can offer them the courses that they're currently taking through VLA, and that's our biggest issue.
Yeah, Dr. Briggs, I was going to add that even though we might be able to accommodate some of those transitions at semester, they would definitely be on a case-by-case basis. It would be much more of a challenge to accommodate the high school schedule than it would other areas. So even though that I think it's a possibility, it will definitely be situation-based, still really on availability.
And that would be at the semester end, correct, Dr. Woodward?
Yeah, yes, but even then, it's
still
going to be it's going to be a challenge.
I thought I heard something earlier from Mrs. Sanders that I wanted to clarify too. Mrs. Sanders, did you mention the flip-flop the other direction? So our team, can we state again what the procedure would be or what we would look if somebody says, ooh, I'm just not quite ready to go face-to-face, and so now I want to make the transition the other direction? Face-to-face 4 days a week, 5 days a week.
Do you want to answer that, Bob, or Dr. Howard?
Same situation. I mean, we know we have spots available in some sections for VLA. So if we have available space and somebody wants to move to VLA, then we would allow that to happen as well.
You guys, Kathy, one of the things that I would like to, because I was with you also, and I'm looking at the exact same thing and that you are, and actually I'm looking at if we waited, actually doing it this way is actually more of a phase in than it would be if we started 7 to 12 all together on January the 4th. That's where I flip to seeing this as the 2 days. The 2 days is still a maximum of 4 days. You still have the Wednesdays off. I felt like this is actually phasing in those upper grades. And because I was on the same page as you, but the more I thought about it, the more I think this is actually this is a phase-in approach. Whereas if you go the K to 6, now and still leave them, and then they all jump in 5 days a week on January the 4th. I feel like this is more of a phase in. And so I actually,
We agreed.
that's one of the reasons I've come to
Yeah,
see this.
and we looked at it, Keith, that's exactly right. We did call this a phase-in model because we're not doing 5 days, we're keeping Wednesday, and the fact that we're adding 2 additional instructional days was kind of our phase-in. And we thought that was the best approach when you look at K-12. And to your point, Kathy, I know people have, most districts, I think, will adopt a model very similar to this when they do look at pushing all in. Because I think they still need a day when they're looking at VLA and virtual learning academies and other things that how they're organized. I think it makes sense to us to have that day built in, and at least until the semester ends, and then we can reevaluate.
Yeah, I know we all talked about what we've heard in the community, so I just kind of want to pipe in about some of the things I've heard. I've spent a lot of time, at least at the high school, with students. A lot of them marching band students, a lot not. And what I'm hearing is that some of those kids who are in AP classes really, truly appreciate their teachers and think that everybody's doing the best they can. But when they're only there for 2 days, what they're experiencing is that there's a lot of self-education for 3 days, and that they have 1 day to ask a lot of questions, and then the other day is testing. And so the students themselves are communicating, get me another day in front of a teacher, please. And they're worried at the high school level about how this is going to impact their acceptance to college, and are they going to be prepared? Lots of things. And I thought that was pretty impactful to me, to have high school students kind of begging to be in a classroom because they're worried about their own futures. Every one of them who expressed any kind of concerns was grateful for what we are doing, but was asking, is there another day I can go? Is there something more that we can do? I just need a little more help. There were also some kids on the total other end of the spectrum who are maybe our students who always struggle a little bit more. And they're also struggling even more so with having less time with a teacher as well. So I've heard from quite a few parents that are saying they really think it would be best for their kids to be in front of the teacher more. But then to hear it from those students as well was very impactful to me.
More discussion?
Okay. Any more discussion?
I have none.
Is there a motion to accept the would you like to read the recommendation?
I've been so excited for this moment.
He's been waiting.
He's got all this information he's been gathering.
I've been trying to capture it, so we have.
Well, go ahead.
Go ahead, Keith.
Go ahead, Keith, because maybe
I just want to
add
make one clarification that we're not going to have to vote every time there's we're voting this time as a special condition of I think we need to make it clear that it doesn't come to the board every time we want to. Is that how we all understand it?
Well, I think when the plan changes, that's when it's been brought to us. So this is a change in the plan or model. So I would think.
But if things go, as he said, sideways, and we have to go from green to back to the hybrid model, we don't have to wait till there's a school board meeting to do that, correct?
no. I would think if we ramp up and go the other direction, we're always going to be sure that we're all in consensus. But if we have a situation where we have to say, look, this building per our protocols has to go back to yellow, we would have to have the flexibility to do
Just
that.
to do it,
That's what
yeah.
we're all.
I think that whole.
I just want to
Yep.
clarify, I agree with you.
Agreed.
I just want to clarify that before we.
I would think that whole discussion about what's going to happen for us to move on a building that they're actually talking about now would be a great source of information to us and everyone. But I think the only other discussion is probably going to be after January, if it's 5 days.
And we will have that with the board, obviously.
I understand that. I'm not trying to, just trying to make sure that we don't get someone that says, well, wait a minute, I never saw a vote on this, and now we're back to that's all.
Well, I guess we're considered in the push-in model
Yep.
And we're
Okay.
only modifying it between now and the end of the semester to
Correct.
be a 4-day-a-week
All
model,
right, I just,
right?
And if
Isn't
something
that what
would
we're doing?
happen, obviously we would inform the board, but it would be something like Ryan said, we'd probably have to make a quick decision to do
Right.
that if we're switching from.
yeah, we're not gonna
Yeah, we don't have to.
We're not gonna keep a building open that's got, you know,
Correct.
400
Right.
kids testing positive for
Correct.
COVID.
God, I hope not.
So,
Oh,
Uh,
yeah. So read away, Mr.
All right, so
Unless you- Are you good?
yeah, I just wanted to,
I just have recommend motion to approve changes to the district learning plan and the timeline for implementation of the changes as noted. Number one, change to 4-day per week in-person instruction, Monday, Tuesday, Thursday, Friday, beginning November 16th, 2020, for students in the hybrid cohorts. We will continue to utilize the protocols and procedures as developed in the Learning Plan 2.0 for day-to-day cleaning and sanitizing, wearing masks, washing hands, etc. We will continue to socially distance to the maximum extent possible. Number two, this will keep each Wednesday as a day for VLA students to check in with teachers and as a day where we can continue our additional cleaning protocols on Wednesdays. Note, we are working on what options may exist for students in VLA to transition to face-to-face instruction at the K-6 level at November 16th. And/or we're looking at ways for students to transition from in-person instruction to VLA. Number three,
Wait, is
Sure.
that only K-6? Or if they're going from in-person to VLA, can that be, is that K-12?
I left that open-ended. Do you want me to modify it one way or the other?
I would just say to clarify, Sabrina or someone, if that's.
Only K-6.
That's also only K-6.
Okay.
Okay, got it. So I will put
People, that'll be a question right off the bat that we.
Yeah.
to VLA at grades K-6 only, in grades K-6 only. Okay,
Yeah,
number 3.
7-12 remains.
We are aware of challenges with large group settings like buses, class changes / hallways, lunchrooms, co-curricular classes, etc., and we'll be working to meet those challenges. Number 4, all staff given a medical grade surgical mask each day. Additionally, each staff member has been given reusable face shields. With this PPE in place, staff members would not need to quarantine if noted as being a close contact of a COVID-19 positive individual. Number 5, we continue to monitor cases and know that we are able to adapt and adjust to status level yellow if needed. I might want to say, or beyond. Number 6, we would monitor and have breathers, if there's a better word, at Thanksgiving and winter break to assess and digest data and how it's going. Number 7, now this wasn't said overtly here, but it was a part of what we talked about in our plan today, so listen carefully if you don't like it. We are asking families, so you did say this, Chris, we are asking families to be extra diligent over Thanksgiving and winter breaks, specifically considering their social and holiday gatherings, i.e., avoid large gatherings when possible, keep on masks, keep 6-foot social distancing, etc. These gatherings are currently being identified by state authorities as one of the main sources of community spread. Number 8, our hope is to then transition to 5 days per week beginning the second semester and to have a plan for students in grades 7-12 to transition from VLA to in-person instruction or vice versa at that time. This will be decided in November, December by the leadership team or something to that effect. And then finally, we have discussed the plan with Joe Mazzola, the Franklin County Health Commissioner, and Alex Jones, Assistant Health Commissioner / Director of Prevention and Wellness, who has been handling the infectious disease tracing for COVID-19 in Franklin County. They have noted that they're having these same conversations with many school districts in the Columbus area.
Okay.
Good. And Kathy, I do want to comment, I just got feedback too. I think part of the issues when we were looking at that phase-in approach at the lower grades was it was going to be a family scheduling problem, because if you have kids at different ages on different schedules, we thought that would be not real conducive to families as well. So that's one of the reasons we looked at it as well, because if you have obviously have a kindergartner and a 7th grader or 6th grader, it's going to look a lot different. And so that was just one of the factors.
Okay. Is there a motion to proceed with what Ryan?
Now, I did want to note, because Kathy, I also heard that Mrs. Olszewski offer to bring the K-6 back, consistent with everything noted above, and to keep the 712 students virtual the rest of the semester. To be fair, the first group of things that I read would have been consistent with what Chris had read off, what we had discussed as an administrative team. But certainly there is also the proposal to do that K-6. And we are open to if there's any adjustments that need to be made.
Well, the recommendation is
Now,
approve what you read
that's our
on
recommendation.
here
That's
is the
correct.
approved changes
That is
to
correct.
the learning plan and the timeline for implementation of the changes.
Correct.
I'm just asking if there's a motion to approve the changes to the district learning plan.
Is that a motion or a resolution? I mean, it had 8 points to it.
That is our recommendation.
Recommended motion.
Correct.
That's the recommended motion. Is there a motion?
So
So,
moved.
Does one of you want to be a second then?
I'll second.
Motion and a second. There's a motion and a second for all of those things that Ryan read, which you did a fantastic job.
Good job,
That was
Ryan.
very, very clear. Any further discussion? Can you call the roll, please?
Mrs. Niekamp,
Yes.
Mr. Christoph,
yes.
Mrs. Sanders,
Yes.
Mr. Lopez. Yes. Mrs. Olszewski.
No.
Thank you all for the great conversation
Absolutely.
and study. I think you guys were able to bring us a lot of information. So there's four information only items. Do you guys have comments for any of these? I mean, I know I do for number 4, just a brief comment about what we put on there. Do you want to talk about any of the first 3? Only, I mean, that's up to you. Do you have a COVID update? Do we have a levy campaign update? You can do whatever you want with information only.
Ron, I think I'll just comment. I'm excited this is such a weird time in education and being on the ballot and trying to do and get information out to our community. But I want to commend, I think our levy committee's done a great job and Ryan and I did the best we could in the spring of getting out to as many civil and civic organizations as we could. And I really hope people do see the need for this levy. Obviously we're in a pandemic, but that doesn't take away the fact that our houses are still selling, they're still building homes, and the fact that we're going to have 1,000 new students in the next 5 years. So I know a lot of people try to find a reason to say no sometimes, but I will tell you this is critical for our school district. We have an opportunity to really, really provide our students and our staff the appropriate learning environment. And I hope everybody sees that in the community and will take the time to review the information that's out there. It's a good value for what we're getting, and I hope our community can see that. So that's our levy update. And if you need signs, let us know.
COVID update, we had the dashboard.
Yeah, is it okay to just continue to leave that COVID, those URLs to get to the state site? And then, the tracking sheet would have been updated.
Jody, I have had some questions from the community about the numbers that we're showing versus the numbers that the state is showing. I'm assuming the differential has to do with things like lag and whatever else the state does with the numbers that we give them.
Yeah, I was reporting it weekly, which was what was mandated. And then I want to say maybe it was last week or a week and a half ago, they changed and we now have to report daily. So that might be the change in what they're seeing. So now that that is updated every day. So I just sent the board member our numbers for today, which was posted on the dashboard. It should be today because we resolve all of our actions on that dashboard. But
we provide the data to the state
every day.
Okay.
I do it before I leave work because they recommend doing it late in the day so that they can get more of a real-time snapshot.
Okay, great, thanks.
You're welcome.
The only thing I had on item 4 was our Citizens Advisory Committee is now for information, so we have it on the record. All the individuals that have agreed to participate, that is taken care of. Kathy, do you have one more to add? Okay, so we'll add another one there. When we have that one resolved, we'll be adding one more to Kathy's group. I think she's waiting to hear from an alternate. Our facilitator is going to forward an outline for the first meeting. So as soon as she forwards that, we'll make sure everybody has it. I asked her if we, and this could be if the board believes it's a good idea, if we can send that outline to people. They have an idea because there's a lot of thought-provoking questions, I think, that she's going to put on there, like what do you envision as X? So that it gives people a chance to think a little bit about that ahead of time. So as soon as we get that, we'll get that out to people. The first meeting will be in 2 weeks because the 19th next week was not enough notice really to our participants. And for her to turn around and try to customize the questions to each of the groups. So I'll pass on any information. Do you all want to contact your team about the meeting, or do you want me to send out a mass email to everyone on the list about the meeting being the 26th at 7 p.m.?
Can we just do the mass?
I think it's better.
It's fine. I can do that. I just need to know if you guys want me to do that.
Yeah.
Okay, then I'll do that tomorrow.
And Lori, can I just comment on that too? I want to thank the board for taking this committee group on. I know we got a lot of parent feedback or community feedback. It is something I think is very important for us as a board and as a community. But the thing that I'm most excited about is I looked at the groups and I just want to reiterate to people that are listening, we're going to be addressing a lot of staff and lack of diversity knowledge, students' lack of diversity knowledge, recruitment and retaining minority staff, curriculum issues that we have, and possibly equitable discipline. And I think it's important that people understand those are things we're going to talk about and address as a board. And those are a lot of questions I know we still have from some of the community members. And I think this is a great opportunity for us to do it. We're including a large group. People have said it's too big. I said, no, it's actually exactly where we need it to be because we had over 200 people express interest to be involved in this. And we accommodated 75 with 10 alternates. So we're going to get good feedback and we're going to get good results and we're going to develop an action out of this. And I think I commend the board for taking this on. And I think it's going to address a lot of issues that we're facing. So thank you.
Well, I think we're all excited to finally get underway. So I'll send that out. So I don't know if there's anything else, any comments under any of the information items that anybody wants to make.
Yeah, I guess I just had two going back to the vote tonight. Are we planning on issuing a statement to the community about the decision and that type of thing? Okay.
Yeah, we want to get that information. That's obviously one of the things we want to act on pretty quickly.
Part of the reason why I wanted to be so careful about what I wrote out,
Absolutely.
because we've just already killed 2 birds with 1 stone and
Right.
started to already hit tomorrow's announcement.
Yeah, and so, the only other thing I want to say about the CAC, the Citizens Advisory Council, for those of you who have hung with us now for the last 2 hours and 45 minutes, there's been a lot of chatter in the community, primarily on social media of late, about diversity in this community. And I'm just going to go on the record as saying we believe that is a vital, valuable element to this community, an element that's changing and growing and morphing and shifting, and it's a healthy variable. But not everybody's going to get their way. And what I'm most excited about this advisory committee is that it will allow the board to take pretty much the rest of this school year, give or take our schedule, to sit down with the community, 85 of you, and talk about issues that are important to us. And this will be a healthy, respectful discussion and debate and deliberation. And we're all going to listen, and we're all going to be respectful, and no one person's going to get their way. And so for those of you who are not on the committee, I believe we're going to have the availability to listen in as a community member or as a staff member to our conversations. But this is a good step for the community and the school district, and we're all going to come out as friends on the other side. So that's all I want to say about that.
I had one individual email that had questions, and I believe 2 of her 3 questions would have been answered tonight. One question was regarding the educational model and what that we think that might look like. One is the actual diversity committee, and Kathy talked briefly about that. We had over 200 people actually submit their willingness to volunteer. And so did this individual. And if you weren't chosen, it didn't mean that you couldn't have fit well. Everyone could have fit well somewhere. It's just, it morphed and it grew a little more. And Joelle was, I thought, very good in saying, this is your optimal number. So really don't go over it.
Explain who Joelle is.
Joelle is the facilitator that will be with us, who is also, did we introduce her at one of the board meetings?
I don't think so. That's why
I thought we did. I think she came on. So sorry about that. If you were not here when she was at one of our board meetings, she is with Bricker and Eckler. I have a hard time pronouncing her last name. You will get to meet her. We'll introduce her and let her talk about herself. She's going to keep us on task, on time, and make sure that that she listens and comes up with our framework for each time that we meet to help us move and make some good progress. So again, we had 200 and some people. We've got 75, to 85 people that actually did get to be on here. We'll probably keep that list because you never know in the future, people may have to come and go. But we certainly hope everybody will take the opportunity to join in and listen. We'll make sure that it gets advertised on the district website and social media when those meeting dates are. So that was her other question. And then the other one was regarding a personnel matter, which we would not discuss in public at this time. So I wanted to make sure those were the 3 things that came in on a question. So thank you for your question. I hope that helps with the answers. And then the last thing we're at is board member comments. Any other board member comments for the evening? And if there is nothing, do we have a motion to recess into executive session? Let me read the numbers. I should have them memorized right now. Per Ohio Revised Code 121.22G, conferences with an attorney concerning disputes over pending or imminent court action.
So moved.
Second.
Could you call the roll, please?
Mr. Kristoff,
Yes.
Mrs. Sanders,
Yes.
Mr. Lopez,
Yes.
Mrs. Olszewski,
Yes.
Mrs. Niekamp.
Yes.
And again, thank you to everyone for joining us this evening.
Thanks, everyone.
We'll be back in 2 weeks. We'll have some good information, and thank you again for joining us. Have a good evening.